Personally, I just want to say, for my personal journey, I want to say thank you to Dr. Holloway. And like me, there are many others in Region 7 and beyond that have been impacted by her leadership, her love, her welcoming attitude. As you will see, many of you have also done, but she has been exceptional, especially in my journey. So thank you. And thank you on behalf of RNO for your deep and enduring contributions to RNO consistently. At this time, we would also like to recognize our special guest today. But before we do that, I would like to call for a moment of reflection for members who have contributed to RNO during the past 101 years and who are not here to celebrate with us. So can we just spend a moment to reflect on their contributions and why we are here today, and because of them, because of the brave steps, where we are today. Thank you. Now, I would like to name and welcome our special guests. Please stand and be recognized if you are a member of any of the following groups, and please hold your applause till they've been named. And no favoritism, okay? RNO's past presidents with us today are Dr. Imogene Baynock, Dr. Angela Cooper-Brathwaite, Morgan Hofart, and Dr. Claudette Holloway. Please clap. RNO's Lifetime Achievement Award recipients with us today are Dr. Angela Cooper-Brathwaite, Una Ferguson, Suzanne Finney, Dr. Cheryl Forchuk, Dr. Paul-Andre Gauthier, Dr. Ruth Lee, Kathy Morland, Hilda Swirsky, Helen Tyndale, and Jane Underwood. Please stand to be recognized. Thank you. RNO's members emeritus with us today are Dr. Imogene Baynock, Teresa Brisnix, Margaret Boyle-Class, Dorothy Boyer, Marion Cochrane, who is sick today, Penny Demarest, Barbara Els, Dr. Cheryl Forchuk, Janet Heinberg, Dr. Jocelyn Hezekiah, Sandra Kendrick, Ruth Lee, Diane Matthew, Kathy Molan, Beatrice Ozom, Marilyn Parsons, Ellen Shipman, Hilda Swirsky, Helen Tyndale, Edith Wiley, Himali Parmar, Jane Underwood, and Connie Whiteman. Please stand up and be recognized. At this time, I would like to ask if I have missed any of the RNO past presidents. And I did miss Paula. I shouldn't have done. I'm sorry. Paula Manuel, special applause. Lifetime Achievement Award. I'm sorry. Did I miss anyone else? No? Okay. Hey? Oh, Debbie came. Another applause, please. Sorry, Debbie. As you know, the AGM is big, robust, and sometimes I slip away. Thank you for coming here, and thank you for your constant engagement and contribution to RNO. I would now like to introduce each of our 2025-2026 board members. I ask that you hold your applause to the end, okay? NP Lamotokar, President, Sue Labo, President-elect, Huda Muhammad, Region 2 Representative, Ashley Fry-Rourke, Region 3 Representative, Poonam Sharma, Region 4 representative, Laliza Turner, Region 5 representative, Sonia Chin, Region 7 representative, Kathleen Peacock, Region 8 representative, NP Devalo Hachu, Region 9 representative, Dania Versailles, Region 10 representative, Adrian Capps, Region 11 representative, Dr. Michael Scarcello, Region 12 representative, Una Ferguson, Interest Group Representative, Dr. Edward Cruz, Interest Group Representative, Hugo Tam, Student Representative, Dr. Tecumseh Ed Connors, Knowledge Keeper and Public Representative, and Dr. Doris Grinspan, Chief Executive Officer. Please stand up. Thank you. Thank you very much. I'm pleased to report that over 600 members and other guests have registered in person for our AGM events this year, and hundreds more are following this proceeding by live stream from across the world, including Dr. Jocelyn Hezekiah, RNU's first Black president, who is 96 years old and has not missed a single AGM and is currently watching from Trinidad. So inspiring. And colleagues, it's inspiring to see the vibrant and active engagement of members, a true testament to the force of RNU in shaping the present and future of nursing, health, and healthcare in Ontario and beyond. Our gratitude to May Tao for being the chief scrutineer for this year's AGM. Please give her a big round of applause. May Tao is a health promotion specialist at Toronto Public Health and RNU's Best Practice Spotlight organization lead. She also mentors several BPSO hospitals in China, and she was hosted in China in September 2025 with our CEO and IABPG Center Associate Director Janet Chi to celebrate the launch of a new BPSO. Shenzhen People's Hospital was the new BPSO, and joined meetings with Chinese leaders to expand the host model initiative in that country. She has a strong interest in evidence-informed knowledge translation, and effective strategies for guideline implementation. May has been the past president of RNU Community Health Nurses Initiative Group, an executive member of the RNU Faith Community Nursing Interest Group, and the Community Health Nurses of Canada. She's also the co-chair of the Community Health Nurses of Canada Leadership Standing Committee. In her time that she has left, she also leads medical teams to work with local communities in several countries, and countries such as Belize, Greece, Ghana, and Uganda. She's also a keen bird watcher and has traveled to different places to see these beautiful creations. May is joined today by the following RNU members who have generously volunteered their time as scrutineers: Dion Sinclair, and Valerie Fissette, and Crystal McCallum. Some are on their way. Thank you. The deadline for any new business was this morning at 8:30 a.m. Note that the only new business that will be accepted today is any proposed resolution coming from RNU Board of Directors, resolutions coming forward from a member of the association as an additional new business item prior to the commencement of business at the AGM will not be accepted. So only from the Board of Directors. This meets the stipulation in RNU Policy 6.07 and is meant to encourage members to meet the deadline for submission of the resolutions of the AGM. I remind the gathered assembly that it is my responsibility and prerogative as the chair to consider with advisors any items of critical importance that arise during the annual general meeting and to deal with them at my discretion. Options for handling any items may include the following: placing an item on the agenda under new business, referring an item to the board of directors, or ruling an item out of order. Regarding members' comments from the microphone, preference will always be given to RNO members. When you approach the microphone, I ask that you state your chapter or interest group for recording purposes and to ensure that members have the first opportunity to speak. We want to ensure that during the AGM, we hear as many voices and as many topics as possible. To facilitate this diversity, each member will speak for no more than 2 minutes, and we will spend no more than 6 minutes per topic, both during members' voices and during the consultation session. And speakers will be allowed to speak once unless no other members are standing at the mics. I will now present the roll call for today's meeting. As of 8:30 a.m. Friday, May 29th, there are 222 consultation representatives registered out of a possible 301, which is amazing. Welcome to all of you, and thank you for representing today your chapter, region without chapters, or your interest group. I remind you all the important opportunity that you have to vote under the one member, one vote process, and I trust you took full advantage to cast your vote over the past 2 weeks. The results of your vote will be reported later today. In accordance with RNAO bylaws and policies, the proposed resolutions coming for consultation today are not part of the official governance business of the AGM. As such, these are not dealt with during the one member, one vote online voting process. The consultation session will start after lunch. We have 17 proposed resolutions brought forward by the Resolutions Committee that will be discussed and decided upon. If time does not allow to decide on all the resolutions, those that remain will be addressed by the Board of Directors. So let's keep to time. While every attempt will be made to follow the agenda as provided to you this AM, it is always subject to change for unforeseeable reasons. However, the meeting must adjourn by no later than 4:30 p.m., since there are many attendees who must reach their scheduled transportation. We ask that each one of us respect this and clear the ballroom promptly once the meeting is closed. At the time of adjournment, incoming President Sue LeBeau and the 2026-2027 board members will form a receiving line in the foyer outside this room. The minutes of the 2025 annual meeting were available for review by consultation representative prior to this meeting. Are there any? Can we have a mover? So the AGM meetings were there for review. Helen Tyndale, mover. Oh, sorry, Paula?
Paula Manuel, South Chapter. I second.
Yes, thank you. Any discussions? No? Seeing none? Were there any discussions? No. Seeing none, the minutes are carried. I can use my gavel this time. Oh, I have my mentor here. Can we? Can we vote? All in favor? All in favor? You have to. Yeah? Yeah? Thank you. It's passed. Good. I used my gavel twice. Thank you. It's passed. At this time, I would like to ask Dr. Doris Greenspan to present her CEO report to the members. Dr. Doris?
Wow, we are going to try for the first time these glasses. For all of those that complain that they like me more with glasses or not, now is your chance. I still may not even need them. I don't think I need this class. Okay, we will see. What a pleasure. And I still hear chatter, a little bit less, but I think we need to go with that bell again. But I think we are getting most people here. It was full yesterday evening. What an opening, huh? How many of you were there yesterday evening? Stand up, please. Stand up so we see you. Kathy, you did a fabulous job with your people. And Madam President, always a fantastic job. Thank you. Colleagues, it is my privilege to bring on behalf of everyone, because this includes you too, our accomplishments for the year. It has been a fantastic year, it has been a busy year, and it has been a year that we continue to power nurses for the present and for the future. Just to remind those of you that are new, how many of you are new? Please stand up, first AGM. Stand up if you're first AGM. Fantastic. How many of you only have been 2 AGMs? So the first AGM plus the second. 2 AGMs only. I bet you. And with the first. So lots of you. Fantastic. So in case you haven't heard much about the RNO ends, which are set by the board of directors, the RNO ends go like this. So you remember the story. When we hear stories, we remember a little bit more. So it is to engage RNs, NPs, and nursing students to stimulate membership. To advance, why do we do that? Why do we need more members? You will see towards some of the last slides that it's not because we need more finances, but we need no more numbers. Why do we need more numbers? To advance the role of nurses, so nurses can speak out on emerging issues. Let me stop there for a minute for those of you that are newer, but even not so new. We want at RNO to advance the most difficult issues, not just any issues, the most difficult ones. The easy ones are for someone else to do, for other organizations, not for RNO. We are too strong, too courageous, and with big, big numbers. My hunch is we will finish this coming year. When you hear me talk next year, it will be over 60,000. We can't afford to not drive the biggest issues. And we do that so that we influence healthy public policy. So that's the story. More members, not because more money in the bank. And you will hear that we haven't increased the membership fee for a long time, and there is no plan for it because we don't need to. But we do want more and more and more numbers, so to advance the role of nurses, to speak out on emerging issues, parentheses, the most difficult ones that no one else dares, and influence healthy public policy. And I saw already yesterday at the student incubator many, many, many examples of courageous nurses, students, probably even more courageous than any of us here, that speak about the emerging issues and the healthy public policy that no one dares to speak publicly. Enzo, are you somewhere here? Enzo? Enzo, thank you. I want to thank you again and again and again, and you can share more in member voices, and thank you for speaking with me, and thank you for seeing my own, the UN of the EDI office, and seeing yourself there. You are going to see yourself with others, and others will respect you the way that you need to be respected. So the first end, as I said, is more and more and more RNs, NPs, and nursing students to stimulate membership. And well, this year, we ended up with a 5.2 increase in membership, And that actually means that we ended up, this goes like this. That's interesting, okay, good. That means that we ended up with 57,250, and we still have this year, our year goes from, who can say from when to when? Those that have been a long time with Areneo shoot. Who knows from when to when, Kathy Morland, from when to when goes our year? Oh, November 1st to October 31st. So we have a lot of months to go, and we already passed that number. That's why I can predict very quickly where we will be. Trust me, next year you will hear me say over 60,000 members. And just so you see, 10 years ago only, 10 years ago, we were at 40,000 and change. So this is why I'm saying, please use the numbers. Let's use those numbers to drive the most tremendously important change that we need. And for that we do a lot of important aspects of our work, including, for example, the Knowledge Hub, right? Where we focus on equity every day and in every shade, where we do education sessions and where you can come and either do through webinars or other aspects of Areneo work, tremendous activities. Membership and services also is focusing now, and I would like Morgan Offord, if she's in the room, Director of Membership, and her team, Carrie, I saw Carrie and others, to stand up and be recognized as I speak, for the incredible work that they do with everything that is membership. I often hear from members, I call so-and-so in another place and they don't answer. I call so-and-so that I'm retiring and they don't answer the same way Areneo does. You care for people, the membership department, and everybody at Areneo cares for people and for members deeply. And so you do, for the most, one another. And I say for the most because we need to make sure that we do that, like with patients, for one another, always, in every interaction, in every minute, in every time. All the time, there is no excuse for not. So the work continues, and we advance with that the role of nurses. And you heard, all of you that were in the opening yesterday, you heard very much the politicians. And it doesn't matter who comes here, every year after year after year, and they say, Areneo is a powerhouse, Areneo drives policy, Areneo drives the most difficult issues. You heard about the environment they spoke, and you heard about the many issues that Areneo speaks, including the issues related internally to the profession, but also from the profession to the world. This was not always this way. Some of you that have been here many, many times, Paula Manuel is one, Yuna is another. You know that that was not always the way, because not always we spoke with the courage and with the knowledge and with the facts that we have today. So not always the politicians could say that Areneo speaks about what's happening in the world out there, that is happening in everything that is external, but using the power of nursing, because at the end of the day, those are the aspects that actually impact the patients that we care for. Whether in the beds in a hospital, whether in a nursing home, whether in the streets, it is social and environmental determinants of health that decide who is sicker and who is not. Yes, we need more, whether it's beds in hospitals, nursing homes, etc., home care visits. But at the end of the day, even when you have it all, if we don't care for the social and environmental determinants of health, nothing will help. You will still see more the same people in terms of race, the same people that are not respected for gender diversity, the same people that are not respected for not being rich but being poor. The same will continue to happen unless we understand, and don't only understand here, but open the hearts to understand here and treat everybody as equals. As my mentor, knowledge keeper Tecumseh says, not more and not less. Not more and not less. So then we have Michelle Ray and her team. Stand up, please, Amy. I saw Amy somewhere here. Amy Bird, Guideline Development. Janet Chi and Julia Finesco, Implementation. They are working out there, but you will see them. And many others at Areneo that are working with them. This is a team already of over 50 people. 50 people that either are working on developing guidelines, on going to BPSOs, on doing everything that we know about BPGs, alongside with research unit that I will speak in a minute. And then we have the external people here, like Mei Tao. You heard that she was in China, and you have many of you that are working with us in other places. So the opportunities are there for you, so grab them. For those of you that have not heard enough about the BPSO program, it has 3 key pillars: guideline development, guideline implementation, and guideline monitoring, evaluation, and research for the last couple of years, because we are at a different stage again. And not only in Canada we are at a different stage, but our influence is everywhere. Everywhere, with 1,600 organizations, that the entire organization is working based on our guidelines. You go to some of those countries and you will see, you think that you are at Areneo, because they put as many banners that say Areneo as they put about BPSO. So on guideline development, here are the guidelines that we produced this year, and some of them I spoke yesterday evening. And here are the guidelines that are in progress, although remember, this report is from, Kathy, November 1st to October 31st. By the end of the day, I'm going to be asking this again. Because if not, you will come to me and you will say, but you also did this, and you also did that, and did this. That is true, because we release a guideline in February, okay? So it's critically important, if you can put a bit of water for me. Water, like water, thank you very much. It's critically important. Sue is reminding me that it's not only here, because they're not connected, these two things. That's okay. So a lot has happened on that. And we also held this year a BPSO Global and OHT, Ontario Health Teams Summit. Whoa, what a party that was. Any of you that were there in the BPSO Summit and the OHT Summit? Okay, I see several hands. I want to see a lot more hands next few years, because your organizations, you all can take this to your organizations, because it's to the advantage of everybody. Long-term care best practice program, that is Julia Finesco that I mentioned before. I also mentioned Janet, they were outside, but that's okay. It's a tremendous program with coaches that work with long-term care organizations, and their outcomes are incredible. This is a frontier that needed lots of attention for many years, and Areneo is taking it on for already several years, both in terms of policy and in terms of best practice guidelines. And the program also has the clinical pathways. And the clinical pathways is not the same as the BPSO, because the clinical pathways are embedded into EMRs, and when a nurse comes, picture this, the recommendations come down when you have a resident, tell you what to do. It's not that you stop thinking, but it reminds you, if you need more information on the tip of your fingers, of what is it that you should be doing, what are the best practices based on evidence, and it also helps for education purposes. So it tells you here how many homes we have brought on board and how many, over 200 homes that are already with the clinical pathways. Mental health and substance use, you saw yesterday if you were here, Sabrina Merali, an incredible program on youth wellness champions, very much needed everywhere in this country, not only in Ontario, and doing tremendous work with youth in terms of mental health and substance use. And you have here the number of webinars, the number of events that we have done, the work that we do, and yes, the beauty is we also measure everything. And then we have another program related to best practice guidelines. And you need to know, each one of the programs I have mentioned so far, not a penny of membership money. This is money that I have secured for the last many, many years from government. And not only it continues, but it has increased. Not many organizations can say that. Not only it has increased in terms of specific base programs like the overall BPG program, but the indigenous program is a program that we are doing only for 6, 7, 8 years. And now we have BPSOs in indigenous communities. I shared that we were in Pikanjikum recently with a group from the ministry and from RNO to show them the outcomes that we are producing, that they are producing, because it's their program. Our role is to open doors, same as to all of you. They walk through that door because it's their program, it's their pathway to follow. Again, this is not connected, so we will go. It's very difficult with the thing not connected. Okay, here. This year we did something new that I feel particularly very proud about, because it's the same as we have BPSOs all over the world, and I said 1,600, almost 900 outside of Canada, 700, 900 in Canada, 700 outside. We also put a proposal to Guideline International Network for a new working group, a working group to develop methodologies led by indigenous peoples, for indigenous peoples, using methodologies that are not the same. The ways of knowing, doing, being and doing of indigenous communities is not the same, and hence why we need not only to respect and uphold the views, as I mentioned, other communities also, but we also need to learn. There is so much to learn from indigenous communities that we all can benefit in our day-to-day life as well as in our working lives. So the chair of that group is Holly Graham, and I work with my counterpart there and many others, and Dr. Tecams is also part of that group. The research unit. The research unit is a story in itself. Where is Shanoya Naik? The research unit is an incredible journey that is just beginning, I would say, even though we have accomplished a lot with the team Shanoya. It's just the beginning of the day, and 3 years with impact already in measuring, evaluating, and now conducting research funded by CIHR and others. So the future is tremendous with the research unit, and actually next Monday and Tuesday, we are meeting with the International Council that comes to advise us, the brightest and biggest minds from many international organizations that are helping us develop the Enquire data system for the future. And here it is, the research unit and what we are doing. I'm going to close this because it's confusing and go with this only. And you can see the outcomes, and I cannot anyways go through every single one of those outcomes because it will be impossible. We will be here for the whole day. But we do many consultations, we do audits, we go to places, and places come to us to learn. Janet Chi, that I mentioned before, organized, and now it will happen every year, a study tour. We have 17 organizations coming to learn, 17 BPSOs from different parts in the world, China, Latin America, and other countries coming to learn from all the work we do, including with the research unit. And these are the current projects that we are doing, and I don't know if Dr. Alana Coleman is here. Dr. Alana Coleman is the Associate Director for Policy. She and Alexa from the research unit and a group of us are looking at the impact of nurses on outcomes, but not just on one outcome, on the quintuple aim. And if I was doing a class, I would ask someone to tell me what's the quintuple aim, and likely one person will be able to say. If I go to quadruple aim, then maybe 10 people. If I go to the triple aim, it will be like 30, but there is such a thing as quintuple aim, and you should read about that because all the work that you are doing today is being measured against the quintuple aim in your organizations. So Google that, search that, Copilot that. It's about basically the impact on patients, the impact on effectiveness, on cost effectiveness, is the impact on satisfaction, clinical outcomes, and also on staff satisfaction. 5 aims. And that's what is measured, the work of the nurse effectiveness. And it's for RNs, for RPNs, LPNs in other provinces, because we are doing it international, and it is for CNSs, and it is for NPs, and then subspecialties like NP anesthesia, etc. Very good to look at that. If you can go to the Open Library of RNO, which is a library that you can absolutely use, and it will bring you new information. Speaking out for nursing, speaking out for health, related to the third aim, right, emerging issues. Here is what we are. This is the impact of media also, advisories, the work that we have done in policy, the tremendous work that we are doing in mental health and substance use that I spoke about. Media has a tremendous impact on the work we do and on the outcome. Members do, in terms of taking the word out to members and to organizations. The media is our channel to the public. You know, we cannot speak with the millions and millions, both in this country and in others. It's through the media that we do a lot of that, and that's why actually we continue to do media awards, and we are the only, I said this sadly, very sadly, it used to be more than RNO, but for the past 5 years, the only health organization that is still doing media awards. And we should, and it should, thank you for the applause, but it should be way more than RNO, because the media is our conduit to the public. So it's absolutely critical. And the beauty with RNO and the media is that it's not just these 3 people there that speak with the media. In fact, most people that speak with the media is you. So I'm saying this especially to people that are new as first AGMers, we will call you, or second AGMers. But to everybody, if you want to speak with the media, if you think that you want to develop guts and capacity to communicate, come to us, we will train you. And speaking with the media will help all of us. Just picture if all of you, right, or half of you, were saying, let's speak, let's take it on. The same as I think was Lamo that said, or Claudette, or someone said yesterday, I overheard as I was walking, if you bring one more member to a reunion, instead of being 57,000, well, actually we will have all nurses. Picture that. If we brought one person, each one of us, to speak with the media, just picture, it will be endless, the capacity that we will have to influence, because with the media we influence. Politicians, see, politicians, when we post in social media or when we are in mainstream media, politicians watch. Because you know how politicians work. Those visits that you do of take your MPP to work or go to visit MPPs, that's their bread and butter to speak when they are in the legislature. When you speak with politicians, they have bread and butter to say, my constituency, the nurses say, the nurses want. And at the Premier's office, and at the Minister's office, and at the Chief Nurse's office, I hope, but certainly the others too, and every opposition party, every morning, they get a media briefing, written, well, now it's not written, now it's online, of who spoke about who. Because that's how they can prepare to the legislature to be able to either say, wow, the nurses say, or wow, the nurses say, right? And so that's the debates that you see sometimes in the legislature, and is fed by what we speak with politicians, either in their offices, not just we, but others, either in their offices or through the media. And it is critical, therefore, that we speak more and more and more in the media, because, you know, the one that screams the loudest is the one that gets the results. So it is our role to speak with the media and do that unapologetically. We also have done this year, and more than ever, op-ed pieces, big, long pieces, that when I see something that absolutely bothers me terribly, a letter to the editor is not enough. So either I ask Marianne, and she must be here, to draft something and then I review, or I take upon myself to write it myself and send that to Combs for having a quick look and sending it out. So the op-ed pieces is a new strength that we have brought in full force to Areneo, and we are doing more and more of those on areas that are significant. Especially difficult was this year to write the one about Alex Pretty, a nurse, RN, that was murdered in the US for defending a person against ISIL. And there is no op-ed piece that is easy to write, but it's more difficult when it's about someone that cannot even see that we are trying to help. But hopefully others were able to help, to see that and help in the US. The Falls Tour, that's all about you. How many of you were involved in Fall Tours? How many? Hands up. Okay, next year we want to see more and more hands. So here you go. Lots of opportunity here to be able to do that. And the Falls Tour is done by everybody. And here is the results of media. Over 700, almost 800 people, 800 people, not that spoke, but 800 that were heard or read. Those are published pieces already. Awards recognitions, every single year we get award recognitions. This year was no different, and this year was in the campaign that we did during elections. And then in terms of public policy, I mentioned before, and I want to repeat, thank you for responding to those action alerts. It's an easy way for you to take action, takes a click of a button, and it's important that we do. And President Lamo Dolkar said to the board 2 days ago that it is beautiful, the extent of reporting and clicking for action alerts, but that we want to impress upon you not only to press the click send button because everything is ready for you, to only do that for nursing human resources, but do that also for environmental and social determinants of health issues. Reports, we have continued to produce reports that are being used absolutely everywhere, and here you have the advances for ARENS that we accomplished in 2025, the advances for ARENS that accomplished in 2025, and the list goes on and on and on, and the same goes for nurse practitioners. How many, I'm not going to ask how many of you are RNs because most of you will stand up. How many of you are NPs here, nurse practitioners here? The advances for MPs, all there. And yesterday we had 7. We have here. That's right. I need to look like this, not only like that. That's absolutely true. So Eric, you are a long-term and very committed member. The advances for MPs that we have done this year are tremendous. Convey that to your colleagues, most of whom likely are working as we speak because we don't have enough MPs. We don't have enough RNs. We also don't have enough MPs. And so I want to also mention about cybersecurity, and I don't know if my colleague Ishan, Dr. Ishan is here, but he and Dr. Beto and their entire team stand up and be recognized, but here we are, because I don't know if he was insinuating to me, Doris, speak less about this, or he was saying what he said, which was, Doris, every time you talk about the environmental crisis, we have issues. Because it's true. Because people pay attention to what we say. And because we speak about the most difficult issues, cybersecurity is critical for RNO. So to Ishan and to Beto and to the entire team, kudos for you, because we never, touch wood, we never had that an issue at RNO, never, ever. And that's entirely to their, kudos to their team. And we do actually, like fire drills, we actually do cybersecurity drills. Finances is not what you need to worry, although my chief financial officer to be in 2 days, and I also should have said my chief information officer, Ishan, is happy that we have these finances, but you heard, those of you that were at the opening of the official opening of the office, when Wanya said, you know, I came to RNO because of the values, because I wanted to do something important, because I wanted to make a difference for people. That's the type of quality of people that we bring to RNO. Yes, of course we bring top-notch, absolutely top-notch experts, but we also bring top-notch, amazing human beings. So thanks again, Wanya and to Ishan, and to all of my team, but I refer to the 2 of them because they're not nurses. They could have chosen something else, not the Professional Association of Nurses, and they found the meaning for their lives in the work that we do, and yes, they're helping us doing much better, and that's because of members. That is what I said that we did in November, which is not in this reporting period, but I needed to show the picture, because this was the release of the Addressing Anti-Black Racism in Nursing, a significant issue that continues. Hopefully, we're opening doors for it to get better, and the press conference with our colleagues was tremendous, some of whom you can recognize because Dr. Angelita sang the O Canada yesterday, Dr. Bukola is there, and Stephanie Buchanan, who you likely have seen also, our colleagues that did the work. And that's Jocelyn. And I want to say hi to you, Jocelyn. I don't know where I need to look to say hi, but I do want to say hi, because it's true. She does not miss a single AGM. In fact, I get a phone call or I give a phone call every single year before the AGM to send her the link, to tell her how beautiful she continues to be at 96. She's still dancing. She just told me she now dances with a cane. I said, it must be a very beautiful and fancy cane. And then she sent me a picture with the cane, and my golly, it is fancy and beautiful. So I don't know if my friend and colleague, leader Imagine Bainok is here, but Imagine, are you here? She's not, she was yesterday night here. But Imagine went to visit her, and she told me about that. Jocelyn told me, she tells me everything that is happening, so behave. And she is an amazing human being and a power force. So these are the collaborative spaces that some of you had the pleasure to look yesterday. I do want you to come to home office. This is your home office. It's absolutely yours, every single inch of it. And it's our collective effort. And we did unveil 5 new collaborative spaces, indigenous collaborative space, and you can see Edith Montour, the first indigenous nurse in Canada, needed to study in the US because Canada would not accept her to study. The 2 SLGBT, the rainbow nurses, we named the 2 SLGBT under the first equity group in RNO, and then Bernice Carnegie, who was the first black nurse in Canada and also could not study in Canada at the time, and their families were here, were at home office, and we worked with the muralists and with them, and I was honored that the board decided to name the Leading Change space after me, and I had the privilege to have my husband and the kids and grandkids hearing to that, saying, especially my grandkids, proud of you, proud of you. I said, become a nurse. This is what happened when you become a nurse. When you become a nurse, you get this. That's it. So that's all of you. And it wouldn't happen without all of you. And it wouldn't happen without the board of directors, and it wouldn't happen without the staff, because at the end of the day, it's together that we power the future, together for you and for the next generations of you. Thank you very much. The report. Now the report. Look at her. She's already take the QR code. That's the new report, the new annual report. Take the QR code. Also, the board can take the QR code. You haven't seen it, but you actually are privileged. You get a hard copy. No one else does. So take that. So thank you very much, and miigwech to all of you. Thank you. Congratulations to all of you.
Thank you, Dr. Doris Grinspan, for your powerful messages. I believe we have a video that we are playing now. Raul, are we playing the video?
We are not.
Oh, we are playing the video now?
No.
There's a video that you should all watch.
Yes, you're right. I'm so sorry. My fault. You're right.
It's my proud pleasure to bring congratulations to Dr. Doris Grinspan on 30 years at the helm of RNAO with up to 60,000 members, and yes, I am saying 60,000. RNAO has achieved what many professional organizations in the world don't even dream of.
Doris, this is Jocelyn speaking to you from Trinidad to offer my congratulations on 30 wonderful years at RNAO. You have been an awesome leader.
Dear Doris, you and I are probably the only ones that remember the discussion in my office at Mount Sinai 30 years ago about whether you should consider to apply for the position of CEO of RNAO. Well, 30 years gone by quickly, and the impact that you had has been absolutely phenomenal.
Hello, Doris. For 30 years, you have held the leadership role as CEO of the Registered Nurses Association of Ontario. But what truly sets you apart is not the length of time, but the breadth of impact.
Doris, a big thank you for your 30 years leading the Registered Nurses Association of Ontario. You have made an immense contribution to the organization and the profession of nursing, not only in Ontario, but globally.
Congratulations, Doris, on 30 years, and I wish you all the best. You've been a great inspiration to many of us, including me.
I would like to commemorate and congratulate Dr. Doris Grinspan on her 30th anniversary as the CEO of the RNU. I met Dr. Grinspan in 1996 when I became a board of director member of the RNU. I've worked alongside her in many different roles.
Congratulations on 30 extraordinary years at RNAO. From the first day that I met you as an undergraduate nursing student, I was struck by your vision, that ability you have to see a better future for nursing long before the rest of us even imagine it.
Hi Doris, congratulations on 30 years of serving RNAO and far longer for the entire nursing profession. I want to thank you for all what you've done for me as an individual. The support and the teachings I've received from you are invaluable.
I cannot imagine how much of an influence you have been, not only in the lives of many nursing colleagues, but in my life as well, where you have shown me how to lead with kindness and compassion, and I'm forever indebted to you for this experience, for this learning journey, and just for sharing the space with you.
30 years went by so quickly. You have been so influential and throughout my career. You have been a person that I have looked to for guidance on media relations, on speaking to politicians, and on just making causes known that are important to our patients and to communities.
I'm honored to speak on behalf of all the staff who have had opportunity to work with and learn from you, Dr. Doris. Your passion for advancing health and well-being of individual and community through nursing is deeply inspiring.
Doris, when you began, nursing leadership was often defined by practice, by institutions, and by the very boundaries of the healthcare system itself. Over the course of many years, you have helped redefine that idea entirely.
You have always spoken truth to power, providing voice to things which at times are uncomfortable but essential to the issues of health access and equity. Congratulations and thank you.
Dr. Grinspan is a transformative, authentic, passionate, compassionate, strategic, courageous, visionary, value-driven, and inclusive leader.
And I've always appreciated being able to come back to RNAO and to the work that you've led to enable us to speak from a grounded, well-informed, evidence-based place.
I wanted to wish you all the best for the future, whether it be at RNAO or elsewhere, and thank you so much for your service. Thank you, thank you, thank you, Lori.
On a personal note, I want to thank you for the mentorship you've given me. You've shaped me not only as a professional, but as a person. You've pushed me to lead with clarity, with intention, and with heart.
So all the best, enjoy, celebrate.
Thank you, Doris, for 30 successful years, and congratulations.
Congratulations on 30 years at RNAO. It's an honor to walk this journey with you.
Your single vision has been so instrumental in bringing RNAO to where it has been today.
Thank you for making the decision to do it, and thank you for everything you are doing every day.
Congratulations, and as you continue to lead us, I wish you every success, and I love you. Take care.
May you continue to inspire and lead us. Tu amigo, Anela.
This is to celebrate the 30 years milestone that Doris has given to RNAO as the senior executive leader, and we want to join the association. Doris joined the association on April 1st, 1996 as the executive director and becoming RNAO's first chief executive officer in 2011. Under her extraordinary leadership, RNAO has become a powerful force in advancing evidence-based practice, health system transformation, equity, inclusion, and social justice. Few organizations have the privilege of being guided by a transformational leader who has helped shape both the association, its members, and beyond for fully 1/3 of its century-long history. The trajectory RNAO has followed for 3 decades, now encompassing BPSOs around the world, is one that is already studied as a model of institutional and societal transformation. And as I'm sure Doris herself will say, this has never been a personal journey. It has been a collective journey, powered by the commitment, courage, action, and agency of each and every one of us, as well as thousands and thousands of nurses and other professionals in many countries. We are deeply proud, and I'm deeply proud to have been part of that journey, and proud to call Doris a mentor. And there are many more in this room who will call Doris their mentor too. Those who were at RNAO home office yesterday know that we officially launched the 4 collaborative spaces, and that RNAO Board of Directors has unanimously chosen to name the leading change space in honor of Dr. Doris Greenspan. Congratulations, and you deserve this and all the more. Let me read you the inscription that now appears on the wall of the leading change space at RNAO Home Office. This collaborative space honors RNAO's Chief Executive Officer, Dr. Doris Rappaport Greenspan, whose work has reshaped nursing, health systems, and public policy in Ontario and globally. As the top executive of RNAO since 1996, she has advanced a powerful vision: health as a resource for everyday living, healthcare as a fundamental human right, and evidence and compassion purposefully driving all we do. Dr. Doris Greenspan has led a seismic shift in how knowledge drives change, integrating evidence-based practice, education, administration, and research with evidence-informed policy to improve care, strengthen systems, and advance population health. She recognized early on that evidence alone does not change practice. Sustained impact requires knowledge transfer and the power of collective identity to mobilize all nurses as leaders, advocates, and change agents. Dr. Doris Greenspan visioned and founded RNAO's best practice guideline programs and led the creation of the BPSO Best Practice Spotlight Organization designation. Globally recognized models supporting the development, implementation, evaluation, and sustained use of evidence-based practice across time, settings, and different sectors. The elements within this space reflect Dr. Doris Greenspan's defining values. The waves in the moss wall that you will see in the space symbolizes the collective energy that transforms evidence into action. The indigenous artwork affirms a profound commitment to truth and reconciliation. Together, indigenous ways of knowing, being, and doing, alongside culturally safe and holistic care, embody an unshakable commitment to equity, inclusion, and social justice. This space symbolizes the global movement in which Dr. Doris Greenspan's courageous, compassionate, values-driven, and evidence-anchored leadership powers nurses and continues to do so, to turn knowledge into action and action into lasting impact. And now I invite Dr. Doris Greenspan to say a few words.
I don't know what to say because I'm not often speechless. And I have seen part of this video, only one part, with the past presidents, some of the past presidents, not even some that are here, but not a lot of the other pieces that are there. And my husband was right when I saw that videos, because the board, without any staff knowing, without even Ricardo knowing, which is unheard of, they consult him for everything, more than me sometimes, did a celebration that, as he said, and it's true, no award that I have received formally, whichever it is more than that award, and of being recognized by your colleagues, because you know you can have all the dreams in the world, but without having architects that we create together the bridges, and that's the partnership with presidents always. Claudette, you were one of those two, and she first was sitting there and needed to sit here now, and you, and the past ones that Angela and others that may be here, those are the bridges, but it is staff and you, right? We create the means, and you're the ones that walk through those bridges. So I guess instead of saying thank you, because I did with Vanessa Burkowski there, my amazing best friend that is watching, I know she's watching and smiling, and yes, I did to the names, Vanessa. I said, and I always say thank you to life. Those of you that know in Spanish, I don't know if Scarlett is here. It means gracias a la vida, thank you to life that has given me so much, both personally with my family and professionally with my family, which is all of you and the thousands of nurses, both in this country and others now, because I lead the Latin America and Spain alongside Raúl Pinto, who composed this video. By the way, thank you, Raúl. That's why he didn't want to show me anything. I said, says here video. Siobhan, did you get the video? No. Raúl, did you give the video? No. Raúl, is that the video that you did for the board? Well, Doris, I can't tell you. It's a surprise. So here, be careful, because now I knew there was a surprise. But shy Wanya obviously is not so shy. Wanya said she doesn't speak. She doesn't speak. I wanted her to speak at the office. So thank you. I have only one ask. I always ask for more things. And it is walk that bridge. You have the architects, and you many are architects in your own chapters and interest groups. You have the architects, you have the bridges, we construct them. This is what staff does, day in and day out, they construct these bridges. Walk through those bridges with values, be clear on what are your values, and if you don't have the right values, this is not the right place for you. I mean it. As my mentor Tecumseh said, no more and no less. Nobody is no more than you. Nobody is less than you, regardless of how you look, what you think, who you love, or what you care for. And that includes the environment we live in, so that we have something to continue for future generations. So all I ask, and I'm going to say now because she's close to the end of her term, all we can ask, right, is walk that bridge. Values, factual information, evidence, courage, because without that, nothing happens, because the future is bright. It may not be bright one day on one thing, but the future is bright. And we need to make it bright for future generations of nurses and everybody else. Any species in this world, and any nurse in this world, here and in other countries that you belong to or that you are home to. So thank you. Gracias a la vida.
Paul Emanuel, South Simcoe chapter, formerly Mississauga chapter, formerly everything, whatever you want to know. This is a crucible of leadership in this room, and it comes with the combination of the board and the members and this little person named Doris Grinspan. And I want to put a shout out to Jocelyn Hezekiah, because she was my Dean of Nursing at Humber College. So one of your ducks has already done her career and is retired, and I'm really happy about that. Doris, retirement is not that bad, if you're thinking about that. I know you've got more work to do, but there's something to be said for doing whatever you want and have your pajamas on at 4 o'clock in the afternoon. So thank you, Doris. I've been in the Assembly since 1992, and so I beat you by a couple of years there. But again, on behalf of everyone, because we can't all get to the microphone, we'll have no time for business. Thank you.
Yeah, just to clarify,
Thank you.
Dr. Doris Grinspan, thank you, Paula, but Dr. Doris Grinspan is not retiring anytime soon. There you go. You know, I believe now that I work as a nurse practitioner in geriatrics, I have to tell you that when the stereotype of ageism, I think we need to get away from that. Everyone who is productive and can perform and continues to deliver, I think we need to stop that. It is based on what they want, how they want, and what they're doing. So let's move away from that. I don't think Dr. Doris Grinspan is going to retire anytime soon. We have a lot of work to do. Look at the political landscape. We have much, much more work to do.
Well,
Kudos to you, Madam President. Kudos. Yes, Doris, keep going. We need you.
So, I didn't pay Paula to say that, but given that she did, and so you don't speculate more, I am not retiring. I have no intention to retire. Thank you for correcting that. I did correct a colleague at RNO yesterday, one of my colleagues that commented on something that other person commented about. Does it happen ever that you hear people say, dear so-and-so? It reminds me one time at Sinai, when I was director of nursing, a gentleman was crying. A gentleman was crying, and I went to see what's happening. And he says, you know, up to 2 weeks ago, I was Professor Dean so-and-so, and now because I'm in a bed in a hospital, they're calling me dear. Can you tell your nurses to stop calling me dear? So now I make it my point. They do call me dear sometimes. I do take the seat in the subway when they give me the seat. That I will take all the time. But if anybody calls me dear in a store, I say, how are you, dear? In any case, so you don't make more speculation, including Paula. I want Jennifer Young to stand up. Jennifer, are you here? Thank you, Jennifer. Stay standing up. Because Jennifer is starting on Monday, not because I'm retiring, but because for a long time I've been thinking about a COO, because I want to have a life a bit, not because I want to retire. I don't want to work 24/7. My grandkids need me, so I am going to work like 18/7, not 24. And she will work 24/7 as a COO, so give it applause. And I must say, Jennifer, I feel her smiling again. And that's my friend Vanessa, who Jennifer considers her mentor. So here you go. She's smiling again. There is a way to life, eh? So thank you, Paula, for wishing me well on my retirement, not yet.
Thank you. We will now move on.
Don't knock it till you try it.
We will now move on.
That's your president-elect saying, you can read it. Yes.
Yes. Thank you for all the camaraderie. The vibrance in this room is infectious, and it warms my heart to see that we have a leader who's courageous, who's brave, who consistently thinks about RNAO as a family. So thank you, Doris, and our collective gratitude to you. Thank you. Sorry.
Now, you need to know this is not because of the 30 years. Every year I get an orchid, okay? Now, have the 30 orchids, well, actually, no, I started this tradition about, I think all of my past presidents got orchids, so I think it's like 28 years I started the tradition. So my presidents, past presidents, and presidents get an orchid, but so do I. So that is not yours, madam. That's mine. But it does look good on us.
Yes, we are both white. See how color coordinated we are.
Yes, we didn't know. We didn't coordinate.
All the stars are aligning, and now keeping back on time. All right, so we are going to move on. Next on the agenda is the Provincial Nominations Committee report, and I invite Dr. Claudette Holloway, Chair of the committee, to provide the report.
Thank you, Madam President. Thank you, NP Lamo Dolkar. The 2026 ticket of nominations was posted on RNAO's website on May the 1st, 2026. This year, the following positions were open for nominations: Region 2 Representative, Region 4 Representative, Region 6 Representative, Region 8 Representative, Region 10 Representative, Region 12 Representative, one representative of the interest group chairs for a 2-year term. The deadline for the first call of nominations was January 31, 2026 at 11:59 p.m. A second call was issued with a deadline of February 23, 2026 at 11:59 p.m. A third call was issued with a deadline of March 20th, 2026 at 11:59. The following nominations were received: And my apologies at ahead of time if I pronounce your name incorrectly. Region 2 Representative Huda Mohammed, acclaimed. Region 4 Representative Poonam Sharma, acclaimed. Region 6 Representative Derek Hutchinson, acclaimed. Region 8 Representative Leanne Lobo, acclaimed. Region 10 Representative Stephanie Malarty and Dania Versailles. Region 12 Representative Sarah Mayaho and Dr. Michael Carcello. Representative of the Interest Group Chairs, Rob Sumalak, acclaimed. The following nominations for board committees were received. Bylaw Committee, Sasha Allen and Lisa De Panfield. Provincial Nominations Committee, Jonalyn Sanson, acclaimed. Provincial Resolutions Committee, Florence Piat, acclaimed. And Jaskanwal Sudan, acclaimed. I would like to thank my colleagues who are members of the Nominations Committee for their excellent work over the past year, and the staff at Home Office for their support. Thank you.
Thank you, Dr. Holloway, and thank you to the members who put forward their names for this rewarding and enriching experience of serving on the Board of Directors and other RNAO committees. I will now officially welcome the acclaimed and elected candidates to the Board of Directors later in our program of events today. The next item on the agenda is the Provincial Resolutions Committee report. And I invite Betty Aldershaw, Chair of this committee, to come forward, please.
Good morning and welcome. And I may mispronounce words when I'm reading the resolution submitters' names later on, so I'm going to apologize for that right now. Anyway, the resolution committee is comprised of general members of the association, the president, the CEO, and the parliamentarian. The committee reviewed 22 member resolutions received by the deadline 11:59 on January 31st, 2026. The committee met on 3 occasions this year to discuss the resolutions. Based on the criteria for assessing and strengthening resolutions, it was decided that 17 should be brought forward for discussion and decision at the AGM. 4 resolutions were not brought forward by the committee and 2 were merged into 1. Members are reminded that resolutions can be submitted at any time during the year, up to the deadline. Should resolutions be submitted ahead of the deadline, the committee will review the submissions by email and provide feedback to the submitters. This provides submitters with more time to have their resolutions well prepared prior to the deadline. Resolutions coming forward from a member of the association as an additional new business item prior to the commencement of business at the AGM will not be accepted, as per RNAO policy 6.075. As such, members are encouraged to adhere to the deadline for submission of resolutions to the AGM. The Board of Directors has the right to submit a resolution at any time up to the date of the AGM. On behalf of the committee, I would like to thank RNAO members for their thorough and well-developed resolutions, and Home Office staff for your hard work and dedication. Thank you.
Thank you, Betty. Wow, 17 resolutions for this 101st AGM, a clear marker of the robust members' engagement. Note that your deadline for 2027 AGM submission is January 31st, 2027. I encourage you to already think about issues that matter to you, your colleagues, and Ontarians, so you can start preparing for resolution submission ahead of the deadline. The proposed resolutions will be dealt this afternoon during the consultation session. I will now ask for a motion to accept the Provincial Resolutions Committee report, exclusive of recommendation. Ramesh, mover, and can please come to the mic. You'll have to announce. Yeah. And then we need a second or two.
Hi everyone, I'm Ramesh from Region 7. I move the resolutions be accepted.
Okay.
Thank you.
Yorkie's chapter, Dr. Rosemary Irish.
Thank you.
Second.
Seconder. Do we have any discussions? No? Can we call for a vote? All in favor? All right. No one opposed, no abstention. It's carried. Thank you. I like that. Every time it's carried, we clap. I have a few housekeeping items before we take a break. Our sponsors are very important to us, and members and guests are encouraged to visit the exhibits that are out there located in the Prince Ballroom foyer. For the second year at the AGM, there are chapter, region, and interest group displays that are located throughout the AGM space. Take some time to look at these displays to learn more about the work of our amazing members. You will find yourself in many of those pictures as well. Many of our chapters, regions without chapters, interest groups, and BPSOs have also brought their banners and signs to be displayed here at the AGM. It's incredible to see so many different areas of the province and of nursing practice represented. Together, we are RNAO, and I'm tremendously proud of all the work that you do each day. Let us take a little break, and we'll come back in 15 minutes. Thank you. 10:17. Thank you. Yeah, we stop. Okay, now I'm going to invite Sonia Chin, Chair of the Bylaws Committee, to come forward and give the committee report.
Okay. Welcome back, everyone. I'm just going to talk about the Bylaws Committee, okay? The Bylaw Committee is a standing committee of the Board of Directors with the responsibility to review the association's bylaws annually, evaluate recommendations for bylaw changes, and suggest revisions to the bylaws aligned with RNAO's mission, values, and the ends. This year, the committee met once to review two recommendations. The first proposes that the designation president be used exclusively for the RNAO president, and the second addresses residency requirements for regional representatives within their designated regions. The committee agreed that the recommended changes should go forward to the Board of Directors for consultation at a meeting preceding the 2026 Annual General Meeting. I would like to thank the committee members for their participation in the business of the committee this year, and RNAO's Home Office staff for their support. Thank you.
Thank you, Sonia. I will now ask for a motion to accept the Bylaws Committee report, exclusive of recommendations. Can we have a mover coming up on the mic?
Elizabeth Strauss, Nursing Research Interest Group, I so move.
Okay. And then can we have a seconder?
Kathy Moreland, Windsor, Essex, I second it.
Thank you. Open for discussions. Does anyone have any questions? Okay, we are now going to vote. All in favor? Sorry? Oh, question? Yes, please.
Excuse me, Madam President, I'm far from the microphone. Paul-André Gauthier, Honorary Life Member. The the word chair in French does not translate. The only translation is president, just for you to know.
Okay, so we use chair. Yeah. The operational things we can use, yeah.
Matthew McGuigan, Community Health Nurses Initiatives Group. So we are an independent nonprofit, and for our legal documents, we have president listed. So this would create a bit of a challenge for us with our...
So I guess these are some operational, some exceptions that we can discuss from the Home Office. But in general, I think to avoid confusion, it is always better to use the chair for regions and all the chapters and use president only for the president. Any other discussion comments? No? Okay. Can we vote? Was it a question? Yeah.
I don't like to be referred to as a piece of furniture.
Sorry?
I don't like to be referred to as a piece of furniture. A chair. And
Can you identify yourself?
Paul Emanuel, South Simcoe chapter. I was hoping that there would be a discussion about alternative naming, because we have executive networking officers as the title for the executive, and I thought primary executive networking officer would be a lead executive networking officer would be preferable to a piece of furniture, and I think that lead executive networking officer might translate into French. Paul Andre will help me on that.
So these discussions are very serious, right? So let's not make a joke about it and say we don't want to be referred as furniture. These are professional designations that are there for committees. So that's what we are asking to move towards, and that's why we are asking for vote. Felicia?
Madam Chair, Felicia Joseph, Durham Region. As I understand it, the word chair, it's a short for chairperson.
Yes, chairperson, exactly. Thank you. So we are now going to call it a vote if there are no other discussions. Okay, all in favor? Okay. Any opposed? Okay. Any abstention? Okay. Motion is carried. Thank you. Now we can clap. Thank you. I am now pleased to present the next agenda item, the Executive Committee report for the fiscal year ending October 31st, 2025. The Executive Committee, composed of the President, President-elect, and CEO, ensure governance best practices across the association and board committees. As outlined in the CEO report, the association has experienced another successful year with strong activities and outcomes. The Executive Committee is delighted to also report tremendous growth in numbers and in expertise within RNAO's operations with new and existing programs and roles. Lastly, the Executive Committee is proud to report another year of robust and sustainable financial results as confirmed by the audited financial statements. At the year end, the BDO, the external auditor, issued an unqualified opinion to the Board of Directors. The Board and Committee are satisfied that the statements accurately reflect the Association's activities. RNAO's strong financial health enable us to deliver extensive member services, robust, free of charge educational events, and the strongest legal assistance and health and liability protection. Notably, these results were achieved without increasing membership fees since 2014, a real dollar reduction of about 25% due to inflation, with no planned increases ahead. This is a rare achievement among membership organizations anywhere. The board has reviewed the financial outcomes and is confident in the association's fiscal stewardship. With the leadership of our CEO, the board and dedicated staff, RNU's influence and impact continue to grow. I thank the committee, board members, and staff for their ongoing commitment and support. I will now invite Lisa Lemo of BDO to present the auditor's report. Anywhere.
Good morning. Thank you for having me. I'm a partner at BDO, and I am charged with overseeing the audit of the financial statements for the Registered Nurses Association for the year ended October 31st, 2025. In our opinion, the accompanying non-consolidated financial statements present fairly in all material respects the non-consolidated financial position of the association at October 31st, 2025, and its non-consolidated results of operations and its non-consolidated cash flows for the year then ended in accordance with the Canadian accounting standards for not-for-profit organizations. What that actually means is it's a clean audit opinion. So I'd like to thank management and staff and everybody that helped us work through the audit for their diligence and hard work for helping us get through the audit and coming to a clean audit opinion.
Thank you. Thank you, Lisa. At this time, we will answer any questions you may have regarding the Executive Committee report or the audited financial statements. Yeah, please come to the mic.
Paul-André Gauthier, Honorary Life Member and President of the Clinical Nurse Specialist Interest Group. Madam Chair, Madam President, as being elected myself 6th time on the Board of Directors, I appreciate the comments that you made earlier that the Board of Directors review and discuss the report, the annual report, because they have a fiduciary responsibility toward the membership. Knowing that they reviewed it, it's really helping us to understand that duly work has been done. Thank you.
Thank you. Any other comments and questions? No? At this time, I'm going to ask for a motion to accept the Executive Committee report. If you can come up to the mic. Yeah. Yes.
Angela Cooper Brathwaite, Durham chapter. I so move that it be accepted.
Thank you. And seconder, microphone 2.
Noah Reisman, South Simcoe chapter, and I second.
Thank you, Noah. Thank you. Any discussion again? No? Okay. I'm going to call for a vote. All in favor? Thank you. Any opposed? Any abstention? Motion is carried. Thank you. Thank you, Lisa. So just when we call for a mover and a seconder, if you are already there, kindly reach to the mic. I know sometimes you are very far, but yeah. Okay, so I would like to thank RNAO Home staff and for the support on the work of this vital committee over the past year. The matter of appointing the association's auditors for the fiscal year ending as of October 31st, 2026 has been decided by the one-member, one-vote process, and the results of this vote will be reported later today, which now brings us to the one-members, one-vote results. Following the close of voting at noon on May 28th, Dr. Claudette Holloway, Maytal, there were some last-minute changes. So Maytal, RNAO's chief scrutineer for this AGM, was the only one who had access to the online voting results. Any proxy votes received by 8:30 a.m. on May 29th were added to the online voting results by the chief scrutineer. I have it. I have it.
Oh, you have it? Oh, I thought you would. Oh.
We are ahead of our time. None of the results were shared at any time prior to the commencement of the annual general meeting. I now have the pleasure of reporting to you on the results of the voting on the governance items. Please clap for all the ones who nominated. Yes, so now, okay. We are now going to read off the envelopes that are there, okay? So which one are we doing the first one?
I'm doing first. Whichever.
The president has a lot of responsibilities, you see?
Go for it.
I'm just going to open. Okay. Okay. Yeah, so I'm just going to read out the names. For Bylaws Committee, Lisa de Panfil has been elected. Thank you. This was for the Bylaws Committee. And now we are going on to the next one. Maytao, you did a good job of sticking this envelope. Oh my God, I feel like Oscars. Okay, so Region 10, Dania Versailles. Region 12, Dr. Michael Scarcello. Oh, I felt I was on the election myself. I want to congratulate all the candidates who put their names forward for these very important positions on the RNO Board of Directors and committees. This is an excellent indication of our members' engagement and passion for RNO and their commitment to join a forward-thinking and dynamic professional association. Congratulations, everyone. I now close the official business of the 101st Annual General Meeting, and I have to sound the gavel for that. Thank you, everyone. Now we are going to move on to our Members' Voices session. We have allocated about 1 hour and 15 minutes for you to share with us your local activities. I remind you that to hear about as many topics and from as many members as possible, we will allow only 2 minutes per members at the microphone and a maximum of 8 minutes per topic. Siobhan, are we keeping time? Yes. I ask that members line up at the microphones and I will address you when it's your turn. I ask that you focus on the outcomes and achievements of your chapter, region without chapters, or interest group. Siobhan Cordell will be keeping time and will signal to me with a stop sign when you have 30 seconds to speak, left to speak, and will signal to me with another stop sign when it's time to wrap up. I want to emphasize again, let's be kind in our communication and respectful. And please use the microphone. Thank you. We can begin now. Microphone number 3. Please identify your name and the chapter or the region that you're representing.
Paul Emanuel, South Simcoe chapter. I'm the chair, and it's my privilege to say there's a pulse in South Simcoe chapter. It's been dormant for a while, but we have had communiques, and we've now been able to get 2 positions filled in the for the networking officers, workplace liaison, and a student. It's a start. I'm very excited. And Noah, you and I are going to talk. Because you're in South Simcoe chapter, so you're not safe now. I know what you look like. It's really exciting to see the outcomes of this successful year. And I'm certainly looking forward to another meeting of the chapter because it's an opportunity to meet members, and they're all in the same vein. It's like they're very proud to be members of RNO. So thank you very much. Appreciate it.
Thank you, Paula. Microphone 2, Sasha.
Good morning, everyone. My name is Sasha from the Durham chapter, and the Durham chapter has been very busy, so I'll provide some updates. So we're very big on mentorship and students supporting students. We started off the year with extending 8 mentee positions. We currently have 2 student E&Os who are very active within our chapter. We support them with initiatives that they do at the school. And currently, we have a combination of 8 students here at the AGM, 5, yep. Shout out to Ontario Tech. We have 5 students through the Board of Student Placement. And then we have 3 that are sponsored through the chapter. So just a quick recap on what we've been up to. So February was a busy month. We had 2 virtual sessions. One of them was facilitated by Dr. Angela Cooper-Brathwaite, one from our student E&O. We also did a screening about Black mental health. And we also had a trivia night. March, we had a fireside chat with Dr. Karima Belgi. And Nursing Week was also busy for us. We had an appreciation dinner with about 60 attendees. We also recognized 5 nurses, nurses and NP from various specialty areas, public health, academia, as well as primary care. And we launched our first newsletter this spring, quarterly newsletter. And we currently have some positions open, so finance, social media, PPAN, or student reps. So great group to be a part of, apply, and thanks everyone.
Thank you. So just a housekeeping item, the 30-second has changed to a green flag, green paper. Okay, so we are going to 4, microphone number 4.
Okay. Need to get it up a little. There we go. Elizabeth Strauss, Nursing Research Interest Group. We've been, again, very active this year. One of the things we really pride ourselves on is our social media presence. We have been very active on LinkedIn, Instagram, and Threads. And several of our social media campaigns involve really amplifying nursing research and the research publications as well as research recruitment that our members are engaged in. In addition, we are currently adjudicating our awards and anticipate giving out about $9,000 worth of scholarships and grants this year. In addition, we are just about to launch a brand new initiative in transitioning away from typical webinars to piloting a podcast on topics related to nursing research and quality improvement. So please look out for those. In addition, we have about half of our executive positions turning over this year, anywhere from our social media, chair-elect, what else? Our student E&O positions. We have up to 4 student E&Os. So those are kind of our main activities for this year. And we are also have begun to really collaborate with other interest groups and chapters, and we really encourage folks to reach out to us because we find that nursing research is something that cross-cuts every interest group and every chapter's work, and we are super interested in collaborating. We've done one webinar with the Mental Health Nurses Interest Group. We're going to be doing one with Rainbow Nursing Interest Group next year, and we're open to any other collaborations that other interest groups and chapters are interested in. Thank you.
Thank you, Elizabeth. We'll go on to microphone number 1.
Paul-André Gauthier, representative of the Clinical Nurse Specialists Association of Ontario. Madam President, I'm pleased to report that the CNS are really active in Ontario. We're co-sponsoring the Canadian conference, the third CNS conference in Canada, and it will be in September 21st. And also the Clinical Nurse Specialists are having quite a few colleague-to-colleague meeting with other CNS across the country. Ontario is joining them, and it's really pleased because the discussion are similar, the problem are similar across the country. And the other aspect also is the collaboration with the American Association. We have quarterly meetings with them, and last week we had the meeting again with the President-elect of the American CNS Association. On another note, I'm the chair now of the consortium, the RNU Consortium for Equity, Diversity and Inclusion. The first article was published in December 2024, and right now our article is going to come out. We are just finishing with the editor the review of the second article, so keep an eye on it, because the consortium is the Black nurse, the Indigenous, and the 2S LGBT, and we are doing a great work. Thank you.
Going to mic number 3.
Hi, my name's Andrea Keller. I'm the chair of the Kingston chapter. We have a really robust group of students between our student ambassadors, our student ENOs, and then other students who've continued to join just as members at large, and really excited to be working with them over the next year. We have attended coffee and conversations at St. Lawrence College, where all of the nursing programs come through and just talk to different organizations. And also a nursing fair we attended this past March as well, so that was great. For membership, we have sent letters to 7 long-term care facilities in our area to try and engage them in RNAO membership and recognize the work of long-term care nurses. Nursing Week was very busy. We attended a long-term care facility one day, and then 2 of our local penitentiaries, and as was discussed last night, those nurses at the penitentiaries really have quite a job to do, and it's a very stressful job, so it's been really great to engage with them. And then I also had the privilege of, at the end of the week, by surprise, to attend Carbeth Care Nursing Home in Gananoque, representing the RNAO, and meet with our MPP of Long-Term Care, Natalia Kustanova-Bashta, and our MPP, John Clark, as they added 104 new long-term care beds there, and also announced another 3-year extension of the BEGIN program. We've met with our MPP. I've met with our City Council about the closure of our safe consumption site in Kingston, and we'll be participating in the Pride Parade coming up in June. So thank you very much.
I do stay at the mic for just 1 second, Andrea.
Andrea.
So Andrea has many qualities, and you all were present when she got an award for some of those qualities. She has a new one, every time a new one, that I have never had, okay? That I'm invited to talk with the minister in a forum that is for an announcement on policy matters, and I called her just to see how she was doing, because I had asked her the day before to go. She says to me, I have the RNO table set up. I go, what? You mean you brought the RNAO table with things about RNAO to the announcement? She goes, oh yeah. She didn't know she should have. I didn't say a thing. I think now we all need to do that. Any announcement, we will show up with tables. That is what it means, leveraging the opportunity, and you didn't think twice, you didn't know any better, keep doing it, now all of us will do it. You set that trend, girl.
We're going to go to microphone number 2.
Hi, my name is Manur Fatima. I'm a nursing student member from Sudbury chapter. I would like to thank RNAO for supporting my travel and accommodation. And as a nursing student and a mother, I understand the challenges many student parents face. We are balancing full-time studies, clinical placements, childcare responsibilities, and the rising cost of living. With cuts to the OSAP and grants, my concern is that people who want to become nurses, especially those with families, may not enter nursing programs because of the financial burden. Their first concern would be providing for their children and putting food on the table. I would like RNO and our nursing leaders to consider advocating for paid clinical placements and free childcare for nursing students so financial barriers do not prevent people from becoming nurses. Thank you.
So thank you. I remember our student, that's bravo, you know, a nursing student coming up and talking, it takes bravery. And all conversations that are uncomfortable, that creates that discomfort is important. Doesn't mean that it doesn't have to be brought forward, so bravo. And she did tell me that at the student luncheon, she had put the pitch, but she was not ready to do so, but she thought that this space was safe as RNO, as an organization that continues to advocate, and she said she mustered up courage and she put it up. So I wanted to commend you for that. There are many opportunities. Also, I would like to say that, you know, the Stay and Learn grant and other opportunities that we talked about at the student luncheon for students that are available, it is just because you don't know, right? But there are many resources, and I believe Adrian.
But we can talk more after.
Yes.
Not in our communities, but we can talk. And yes, we do push for that. So please know with the
Microphone.
or without the pushing for that.
Yeah.
So work with us on that.
Thank you. Okay, so we should use the microphone, Doris, next time. Yes. Okay, so I lost track.
It was number 2.
Can we give special consideration to Una? No? Yes? Can we give, please? Mic number 3?
I was going to say, do you want to just try to do it?
I can go around.
Hi, I'm Una Ferguson, and I'm the chair of the Retired Nurses Interest Group, as well as being on the board. We've been a little quiet this year. I had a little bit of a medical incident in January, which didn't get through until I came to the board. However, Wisdom and Resilience is the retired RN. And although we've had the quiet winter, we've got an exciting year ahead. Be prepared. Get your pocketbooks ready. We may have a cruise. I talked to Doris, and she's given sort of an okay. So, and she said she'll be on it, so that'll be good. We've got a brand new student, hopefully. I think I've convinced him. Mateen Nazari, who is our winner of our $500 bursary. And as I said, watch for an exciting year. Also SNAKE, which I am also the communication officer for. Brenda Hutton, who is the chair, is in England right at present. We have 2 new chairs for SNAKE, and that's really important. We've got Merritt Sadek and Damali Austin, and we are very, very proud to have them. And we've also added 2 students again. So I think we're ahead for a really good year. We put out a few really good events, and I think it'll be exciting. Thank you.
Thank you, Una. And a special mention here, Una was in the hospital, and this is public information, and for quite some time, and she was still attending the February board meeting virtually, and she came here today. This is the first AGM, or first outing, I might say, that she's out with the walker. This is not her baseline, but with the walker to attend the AGM. This is inspirational. Thank you. Okay, now, Madam Past President. Microphone number 4. Rob.
So, Lamo, I would like to say you're wrong.
Thank you.
Yuna actually came to the Region 10 event, the Breakfast with Politicians. That was her first
sorry.
outing.
I thought he just wants to say I'm wrong. It's okay. You're right then.
Rob Samulak, and then this is my final AGM as chair of the Ontario Nurses for the Environment, les infirmiers et infirmières de l'Ontario pour l'environnement. And I am impressed because the environmental determinants of health and planetary health, the profile of this has really grown in the last several years. And I'd really like to thank the executive team, including the CEO, Dr. Doris Grinspan, for really supporting this. We're really targeting the students who are the next generation, and we're trying to get planetary health into nursing school. So we changed our scholarship this year, so we gave out a $1,000 scholarship, and the students, we took it internal so that we could make sure the students were doing something related to planetary health. As well, we've been working for 2 years on the Greening Nursing Schools Community of Practice to support nursing schools transitioning and adding this to the curriculum. We're also, Doris came to one of our Greening Nursing Schools Community of Practice meetings, and we really helped brainstorm how we were going to get this mandated into the nursing school curricula, and we're working with several partners to do this, both in Ontario, but also across the country, and we also have support internationally on this. So, thank you very much.
Microphone number 1. Helen?
Helen Jindale, Wellington Chapter, co-chair. I just want to mention that we met with Mike Schreiner, our MPP in Guelph, last Friday, and Lama was there, as well as Margaret and our student Mateen. Una, we had him first. Sorry? Yes, we are fighting over Mateen, and he's going into his 4th year. Are you here, Mateen? He's supposed to be here somewhere. Anyways, we just hope he stays in the Guelph area, but we want him to be free to go anywhere. So anywhere that Mateen goes, you'll be very fortunate. I don't know when these guys sleep. Anyways, in terms of Mike Schneider, those who were here last night, he is very dynamic in terms of his beliefs and stuff, and he's so aligned with the beliefs of RNEO, the determinants of health. And I think he said last night as well that even though he's sort of Green Party and voted for in terms of the Green, he's very concerned about the caring professions, both teachers and nursing. So we're very fortunate to have him. And I just want to say, on a personal note, I've now graduated 53 years. I was 12 when I started. However, we, as classmates of McMaster, we get together a couple times a year for lunch. And we went around the table in terms of hip replacement, back surgery, shoulder replacement, hip coming up, knees coming. Take care of yourselves. I mean, we worked through times when there was only one Hoyer lift per ward, and we caught people as they were going down on the toilet in maternity. So be very good to yourselves. Thank you.
Thank you. Okay, microphone number 3, Selvi.
Hi, everyone. My name is Selby Bejnot, and I'm the chair for Region 7 Toronto East. I just wanted to highlight our 2025-2026 year. We have over 4,779 members. Out of that, 679 are new RNs, and 102 of them are nursing students. We've held over 4 in-person events and have started having at least 3 MPP visits. So we're hoping to have more visits later this year. We're active on Facebook, Instagram, the X, and we have a social media reach of over at least 1,200. A few weeks ago, we held our Nursing Week Appreciation Dinner at Dragon Pearl, and we were lucky to have Dr. Doris Grinspan participate. It was a very fun night. We actually played charades, and our guests seemed to enjoy it. We're also currently recruiting 2 student E&Os and 1 workplace E&O. So if anyone is interested or know anyone that may be interested, please share the word. We also have our poster highlighting our year at the entrance, so please check it out when you get a chance. Thank you for your time.
Microphone number 2, Kathy.
Hi, I'm Kathy Moreland, Chair of Windsor Essex. Some of you heard from us last night, but I'm just going to highlight some of the things we did this year. We visited 3 of our local MPPs and sharing provincial and local perspectives on staff retention as we lose the majority of our new grads in Windsor Essex to Michigan every year. We talked with our local MPPs about retention and respect and the pitfalls of privatization and the need for an integrated drug strategy that includes safe consumption sites and the need for wraparound services, and I think we all have to keep emphasizing that. February, we co-hosted a webinar with Sigma and Mental Health Nursing Group, as well as members of CUPE, WeRPN, ONA, and had 150 attendees at that webinar talking about violence in nursing. We've now planned our next follow-up session on recommendations for June 18th, so please stay tuned for that. It will be open to all of you. We do have some fun in our chapter. We had a St. Patrick's Day paint party, and none of us are giving up our day jobs. We partnered with our student ambassadors, as I mentioned last night, and there was an award-winning naloxone training sessions at both our campuses. During Nursing Week, I was fortunate to visit 3 of our hospital sites and the university. And during that visit, our members voiced the concerns around no sick call replacements, the need for safe staff-patient ratios, the drug poisoning crisis and its impact on the healthcare system, homelessness and privatization. They were common concerns. They also shared that a lot of RN jobs are being replaced by RPNs. They want RNAO to do more about violence in the workplace. On a positive note, Healthcare is working toward becoming a BPSO, so we're really excited to support them. I see your green. I just want to one quick other thing is that the retired members of our chapter are wondering where we're at with getting the retired RN designation.
Yeah, okay. We are now going to, thanks, Kathy. We are now going to move on to microphone number 4.
I'm Angela Cooper Bradway, Durham chapter, and a founding member of the Internationally Nurses Interest Group. And I'm here to invite all IENs, students, and RNs and NPs to participate in our research project entitled The Contributions of Internationally Educated Nurses in Canada. Most of the research I had reviewed prior to writing this proposal were negative about IENs. This is an opportunity to share your contributions, what you have contributed to nursing in Canada. And I'm inviting you to participate. And we do have I should say, could you stand please? Felicia Joseph, she's a recruiter. She has some handout. For if you hadn't seen it, it has been advertised, but now we're talking directly to you. This is your opportunity to show the rest of Canada what you have contributed to this country. Thank you so much.
Thank you. So all IENs who are IENs, they can participate in that research led by Dr. Angela Cooper Bradway. Next we have mic number 1.
Hi, good morning. Maria Tandock, Mississauga Chapter, Region 4. I'm here with my co-chair for Brampton Chapter as well. And we were originally Peel Region Chapter, so we are still functioning collaboratively for both chapters, but I am going to say we're missing our Caledon people chapter. So Mississauga Chapter, we've been active politically. We had a meeting with Minister Natalia Kutsundova-Basa just a couple months ago. We talked in attendance, there was 5 of us, Salasi, Upneet, Lamo, thank you for coming, and our Region 4 Rep Poonam and Sandrina. We talked to Natalia about primary care crisis, about the long-term care updates in regards to the clinical pathways, and in sharing our successes through RNAO and some of our lived experiences for managing care and long-term care. I want to keep the momentum in regards to fixing long-term care. I did put in a resolution a couple of years ago in regards to dementia care, and I believe that's been brought forward to now a new bill, 235. So I'm hoping that will continue on in order to serve our dementia care population. Also, we talked about the NPs, wage parity as well. We talked about public health nursing in regards to having more NPs in their clinics, especially in the health sexuality clinics. And we invited Natalia to our Nursing Week dinner, which was just a couple weeks ago. She couldn't make it, so I have 2 minutes. She has another 2 minutes. Okay, so...
you can eat up into 2 minutes.
Yeah, do. We'll also give you some information about our Nursing Week event. It was fabulous. I hope many of you will come again for next year. We are resurrecting our newsletter. And so you will find us at our RNAO website chapter.
Thank you, Maria. Okay, now we are going to move on to mic number 3.
Hi there, my name is Marag Mercer, and I'm the chair for the Ontario Correctional Nurses Interest Group, a once very dormant group, I'm happy to say is on its way back. It's been a long year. And I'm happy to say that we're almost there. We do still have some positions open, and elections are open right now, so please join us. We have exciting plans for this coming year, including some webinars, an in-person event, and we're planning to collaborate with some of the local chapters for a Nursing Week gala. So we have been dormant, you haven't heard from us, but we are back.
Yay! Okay. Microphone number 2.
Hi, my name is Akeem. I'm representing the Brant Alderman Norfolk chapter, standing in gap for our chair, Dr. Cheryl Fershak. We also in our reigniting phase of our chapter. We are proud to say that we have filled all positions in our executive committee. Within the last couple of months, we had a couple events, one being a social gathering in our Simcoe region focused on AI in healthcare, and we had our guest speaker from one of the Western universities to speak to the nurses in our region about AI in healthcare. We had our second event where we hosted a dinner where we spoke about different avenues that nurses can take as it relates to nursing within our chapter. We were fortunate enough to submit 2 resolutions this year to this year's AGM. And we have 2 students on our committee, so that's something great. And we are planning to meet with politicians in our region to discuss changes that can be happening in our chapter. Thank you.
Microphone number 4.
Good morning. My name is Sarah Thornley. I'm representing the Rainbow Nursing Interest Group. We sent out a newsletter to the RNIG members for the winter. 5 executive members attended Queen's Park Day, which is great. We had the opportunity to connect and do some planning. And I think we might even have 6 here today, which is so exciting. 3 of our executive plus RNAO staff members led a webinar for all of RNAO to promote 3 parts of the 2S LGBTQI+ health equity BPG. There were over 80 people in attendance. It's a great time. As Dr. Paul-Andre Gauthier already stated, the article by the Health Equity Consortium is about to be published, the second longer article, and 3 of us on the executive are members of this very important group which we work with the Indigenous nurses and the Black Nurses Task Force. RNAO has made it clear it stands behind RNIG and the 2S LGBTQIA+ community, and I'm grateful for that. We have a lot of student nurses in RNIG, and we are planning another event with them around vulnerability and safety. Date to be announced. Pride Month is coming, everybody. Our RNAO is participating in events across the province. Please join us. Such a joyful time, allies, community members. Hope to see you there. Thank you.
Thank you. Microphone number 1. Upneet.
Thank you, Ramo. My name is Upneet. I'm the chair for Brampton chapter. I'll just pick up from where Maria left. Both our chapters have been successful for the honors program that was started by Home RNAO. We did host our Nursing Week event recently. Great interest. We had over 70 people attend, I think. Lamo was there representing Home Office. We had greetings from 2 MPPs, and MPP Deepak Anand and MPP Sharman A. Williams. They attended in person. We have sponsored 2 students from Mississauga, one from Mississauga, one from Brampton, to this AGM. They were actually picked from the students who attended our fall nursing career fairs event. So that's another successful event that we hosted with our members that are here as consultation reps today. They came and they discussed about various professions so that the students can have a little bit of better idea of what they're getting into and what the opportunities there are outside. We also hosted an Instagram takeover from Mississauga and Brampton chapter to get more people, more nurses, more members involved. And I want to say a shout out to our social media ENO Gurneer, who is also here for the first time as a consultation rep. She's an amazing, amazing person. She's really holding our social media post up, so thank you, Gurneer. And we also have a resolution, again in collaboration with the Mississauga chapter, and we are working towards hosting MPP breakfast meetings to, again, keep addressing the vital nursing issues that needs to be addressed. Our ENO elections are up. We have 3 positions that are up for elections. We can have, I think, a couple people per position, so please feel free to reach out. Feel free to apply. We host our monthly meetings every 3rd Tuesday of the month, again in collaboration with the Mississauga chapter. So if any member who is not sure how the chapters work and you just want to attend one meeting, please reach out. And you can see if it is for you, and if you want to be more involved. I'm pretty sure if you attend once, you won't be leaving. Thank you so much.
Thank you. Thank you. We will now move on to microphone number 3.
Good morning, everyone. My name is Selena Carter. I'm the ENO, social media ENO for the Palliative Care Nursing Interest Group. We are a passionate, connected, and very supporting team. Our team nominated our chair this year for a Nursing Now Award, which she won. So congratulations, Val. And we also have a student ENO here today that we're very proud of, who has submitted a resolution, which I hope passes. So back in 2024 at our AGM, our members said they wanted more opportunities to come together and talk and share knowledge. And so we developed a monthly virtual knowledge share called the Palliative Care Compass. And members come and talk about different issues they have, and they can present on different topics. To give you an idea, we had an advanced care planning panel last week. We met with RNAO representatives to talk about best practice guideline amendments and get feedback from our members. We collaborated with the PEDS Nursing Interest Group to have a panel on children's grief and bereavement. And this will go on, so if you're a palliative care nurse and you want to present, please get in touch. Or if you want to collaborate, I think corrections, we could do something together. We also have social media campaigns, so we do a palliative care practice pearls on a monthly basis. We're on LinkedIn, Instagram, and Facebook. so far. We give out 3 RN FU awards a year, and we just had 2 award winners recently announced. And we also are sending over 8 members to different palliative care and hospice conferences over the year. We have 4 student members. We are looking for a workplace liaison, and social media and communication roles are coming up, so please get in touch. Thank you.
Thank you, Selena. And there's an opportunity to collaborate. Correctionals and palliative. Okay. So now we are going to move on to microphone number 2.
Hi, Erin Burrell, Hamilton Chapter. I'm our Finance E&O. I'm pleased to report that it's been a very exciting year of growth for the Hamilton Chapter. We went from having only 3 executive members last year to having a full executive. And that's been great, and that's allowed us to be very active this year. We had several events. We had our fall tour event that Madam President Lamo came out to Hamilton for that event. We had a good attendance at Queen Park, and we were able to bring that learning forward to members of our executive through our social media channel by sharing a lot of the policy that we were advocating for at Queen's Park. As well, we've had many successful events that have led us to repeat those events. So we had a pottery and politics event just for Nursing Week where MPP Robin Lennox was able to join us and discuss the issues at hand. We had a second annual Nurse Appreciation Dinner for Nursing Week as well. And we're looking forward to, for the second time, having our tie-dye event on June 21st in Hamilton in preparation to come out with RNAO for the Toronto Pride Parade. We do have our turnover happening, so if folks are interested in joining our executive, please look out for the applications that are open now. Thanks so much.
Thank you, Erin. Okay. Microphone number 4.
Hi, this is Sheila. I'm representing York East Chapter with my lovely execs here. We are a brand new chapter. We were formerly part of Durham, so it's been a rocky start for us, but we have finally found our footing. We created our social media accounts this year on Instagram, LinkedIn, and Facebook. We also submitted our work draft plan and did some Nursing Week events. We also have an event planned for September.
And we also extend our grateful appreciation to RNAO, especially to Morgan membership for providing the support in our nursing activities at Mackenzie Health, shoulder ambulatory care, and most recently the navigational support for personal support workers, caregivers with nursing backgrounds and internationally educated nurses, and the clinical workshop for internationally educated nurses. So we're very grateful for RNAO, especially to Morgan, for providing all the logistics. Thank you.
Thank you.
Hello everyone, I'm Gino Grospe, also membership E&O from York East Chapter. I'm also glad to share that our chapter's recent attendance at the Cortolucci Vaughan Hospital during the Nursing Week was a great success. So we managed to fill out or almost ran out of paper for the registration for information for both members and interested to become members of RNAO. It's actually a good turnout, and it also gives us motivation to push more and spread the word regarding our brand new chapter. And we're also pushing, especially for the York East chapter, to be involved and be active.
Yeah, thank you. Thank you.
Sorry. Hi, my name is Tiffany Kong. I'm representing
I think time's up,
student.
Yeah? Is it from the same York East chapter?
York East, yes. So we are planning to reach out and meet MPPs and talk about nursing shortage and primary crisis, primary care crisis.
Thank you.
Thank you.
Thank you. Okay, just some housekeeping. So I would like to give opportunity to everyone to speak first, and then we'll have like second time, just like I see speakers coming up again. So I want everyone to give an equal opportunity at this time, and then let's keep to the high level and not talk about resolutions at this time, okay? All right, so let's, now we are mic number 1. I get distracted. Mic number 1.
Hi, Penny Villela, Halton Chapter, Region 4. Oh, thanks for the support. I'm excited to say that we were accepted for the honors program this year. We continue to work with our social media platforms to engage with our members. Out of bringing our MPP to work, we have had many engagements with Halton Healthcare CEO, senior leadership, wanting to continue to collaborate and have discussions. Those were around externs, nursing mentorship, RN prescribed, the NP role, their expansion of hospital beds. So that continues to happen. We've attended many events, one of which was the Hamilton Environmental event, which had Ward 4 Councillor East Hamilton, Canadian Environmental Law Association, where we were able to have discussions around the environment, population health, research data updates, so that was very informative. We had Nursing Week booths at each of our sites where we spent the entire day engaging and celebrating nurses within our region, which was great. We got to have student engagement, meeting with the nurses. Particularly at the Milton site, we were approached by MP Adam Van Couverden, and he wanted to join with RNAO and senior leadership to go and celebrate the nurses, present them with a scroll, and do unit tours. So that was wonderful. Our PPAN, Margarita, I need to give her a big call out. She's been working very hard this year in her role. We've met with MP Joseph Rosinski to open the introduction of what RNA role is, bringing MPP to work for Region 4. We've also connected with Grandmothers Voices Visionary Indigenous Organization, Jody Harbour, for the unveiling ceremony and land acknowledgement in Milton. We were invited to attend the Eid celebration. Oh my gosh, we've got so much. I will come up a second time.
Yes. You'll always have an opportunity to come the second time, for sure. Okay, moving on to mic number 3. Hugo.
Hello, my name is Hugo. I'm the student representative on the board of directors, as well as the chair of the Nursing Students of Ontario Interest Group. The NSO hosted 6 webinars this year rooted in environmental and planetary health, social justice, comprehensive nursing education, social prescribing, and more, really encouraging students to engage in community and policy work beyond clinical practice. We did also do a fall tour with our president-elect Sue LeBeau. I attended a Queen's Park on the Road meeting with MPP French speaking about new grad transition and retention, financial barriers to success within nursing education, community services such as supervised consumption sites, with talking points presented at legislation when it opened up again. We also supported the Ontario Nursing Games co-hosted by U of Ottawa by our chair-elect, Matthew Mark. We did an in-person event, Model Who, at Hennick Humber Hospital, also known as Humber River Health prior, and we did a hybrid model for accessibility. We also piloted an NSO newsletter, which will formally begin in the new term in 3 days. I will be attending the Kazan conference in a couple days, presenting with the NSO Vice Chair, Sierra, and NSO member Scarlett on AI integration into nursing education. And then on a personal note, super proud of Durham chapter on having so many students engaged and involved now compared to 2 years ago. And also thank you for the board of directors for taking me in with such grace, and to Sue, Lamo, and Doris, and the RNAO staff for speaking to me as equals and not within a hierarchy, as I am a student, but I will be officially graduating in a week.
Thank you. Microphone number 2.
Okay. Thank you so much. My name is Azmat Jahan, and I'm from Region 2, Middlesex, Elgin. And I'm an international student doing PhD from Western. Right now, I would like to share my one of the concerns, about the validation or accreditation from the NNS and then CNO as an international students for all nursing documents. So being an international student is so difficult to, follow the same process for the others, like other students who are, or other people who are coming as a nurse here. So I would like to just share that. Can we have some liaison activity or have a pathway to ease the pain of the international student for getting, despite working 10 years in their back home country and coming as a PhD student, not a master or not an undergrad student, PhD student, can we have some pathway to integrate this gap so that the international student not have pain to follow that all the process and spending so much more than $1,000 for that process, and after that the NNS say, oh, you are not validated, like your documents are not validated, go ahead. So it's so difficult to wait for 1 year, complete 1 year. Okay, and as a student, as a PhD, like we have limited 4 years, and we have to do lots of things, taking care of kids and also. And here, I'm sorry, I'm too excited. So overwhelming. I would like to second my one of the student colleague, Mahnoor Fatima. She was also concerned about the financial, but I'm not only financial concerned. I'm concerned about the time also. I'm so sorry for that. But yes, I would like to do something. This is an excellent platform, and this is my first time I'm here. So, so I want to raise my voice and do something for that.
Thank you. I think you should give Dr. Doris a call after.
Thank you so much. Thank you so much.
Thank you. Paul, we're going to give chance to someone else first.
I would like to thank my Janet.
Yes, thank you. Okay, so we are going to move on to microphone number 4. Oh, sorry, it's microphone number 4. Pardon me. Yes.
Hi, my name is Stephanie Ireland. I'm the chair of the Occupational Health Nurses Interest Group. And Sasha Allen is here as well, my social media ENO. For the 2025 and 26 year, we've been essentially getting the group up and running again. And, we have a full executive. We have been running for social media accounts as best we can. And we've been able to set up 4 events over the winter and spring months. The final one will be in June, and we're hoping to set up some more in the fall and next winter. Our first one was a virtual meet and greet, and our very first webinar was actually geared towards nursing students and new grads. It was called Beyond the Bedside, to introduce a different career path to some of our new nurses. And our next webinars were geared towards new occupational health nurses, potentially, and professional development that we're continually needing, to help us with our practice. We also set up a bursary recently, and we initiated a newsletter as well. And we still have much work to do and much to do to develop, but I think we've got a really great start.
Thank you. Okay. Microphone number 1, Janet.
Hello, everyone. My name's Janet Hunt. I'm the current chairperson of Middlesex Elgin. We had a wonderful celebration just recently for Nursing Week. We were a little bit late. We had to wait until May 24th, but that's nurses. We reprioritize and reschedule and do all those things. It was absolutely wonderful. We had a focus on self-care, and this is the first event in almost 20 years that I gave to another executive. I had nothing to do but show up on the day. It was wonderful. We'd had bursaries that we gave out for education, and following a comment that had come from our executive at some stage about, when I nominate people, I have to have their resume and I have to have examples and I have to do all this. It's a lot of work to nominate our peers. So we ran this very easy Google Doc, social media kind of campaign. Thank you, Huda, up here for being our social media executive. And we had members nominated for positions that are for excellence awards for very simple things. And it was just wonderful. It was received so well. So that was a great event. We're moving forward with Bring Your MPP to Work. We're sending out invitations this week. We're bringing them to meet our Thames Valley Family Health Team, the providers of harm reduction and services to a lot of our marginalised population. So it should be interesting to see how that goes. And also for the fall, working with our nursing students at Western to do an event, Introduction to Politics, for the nursing students as we move into, hopefully, coordinating with the fall tour.
Thank you.
So, thank you.
Microphone number 3.
Good morning, everyone. My name is Ngazi from Brampton chapter. This is my second year at AGM. I joined Areno roughly 2 years ago. I'm also my second time as a consultation rep. I was able to attend some events that Brampton and Mississauga chapter hosted, the fall event, where I was able to share my nursing career experience, and also the dinner, which was a success. I want to thank especially Areno Home Office. They emailed my unit manager, Credit Valley Hospital Medicine Unit, and told her that I'm going to be a consultation rep this year. And I'm proud to say I received so much support. And today, my manager, Shari, my clinical educator, Antoinette, and one of my charge nurses, Suprit, are here to support me. Thank you guys for coming. And they even gave me a flower. And I'm making a promise. Next year, I'm bringing at least 10 people from my unit, not just as attendees, but as Areno members. Thank you so much. Appreciate it.
This is the power of nursing profession, nurses supporting nurses, right? Yes, thank you. So we are going to microphone number 2.
Hi, my name is Jody Stapleton. I'm a consultation representative from Niagara. I'm over here by myself, so if there's other Niagara people, please let me know. I'm representing foot care nurses. So we're a unique little category that doesn't exist in the RNAO as an interest group. We just had our conference last weekend, so this is my 3rd conference this week, if I look tired. And basically they meet from all over Canada and do foot care training. The Canadian Nurses Association is now coming out with a certification, so similar to a diabetes educator, you would be a advanced foot care nurse certified. It hasn't started yet, so I'm going to be in that process soon. What's really important about this is, number 1, we all have feet. Number 2, take a check at anyone who is over 60 years old, what their feet look like, or 70 years old, or your parents. Often their feet aren't always in the best shape. Some people I call unicorns, and they're magical, and they have really great feet, but most not so much. So I know they just came out with best practice guidelines that look at foot health and with monofilament neurochecks, and I do an ultrasound on my people's feet to check their blood flow because we don't want them losing their toes or their feet. Especially in the Indigenous community. So what I'm advocating for, I guess, in the future, if anyone here wants to do that with me in the future, is that Indigenous community has the highest rate of diabetes. Diabetes and feet don't go together very well, if you know that. So right now, they can go to community centers to get foot care, but a lot of people can't leave their homes or can't leave their retirement homes.
So Jody, I just wanted to interrupt here. I think sometimes, like when we say, Indigenous communities have higher rates of diabetes or something, I think we should not assume, and we should just, it should be evidence-based and not assume. And so, thank you. But at this point, I really think sometimes there are some stereotypes, and we don't mean it intentionally, and when we express, but they can be taken as that. And so, I just want us to be not assumptive of any of the observations. Thank you. Thank you again.
Okay, no problem. Thank
Yeah.
you.
Thank you, Jody. And Niagara chapter is, I guess, somewhere here, sitting up here. Yeah. And I think we should focus on the various activities of the interest groups and chapters. Let's talk about that first. And then we will, of course, have opportunities for members to come and talk about different issues. So, next we have microphone number... So that was 2, microphone number 4.
Hi, my name is Donna Lawrence. I'm the PPAN for the Black Nurses Leading Change Interest Group. So we're a very thriving group, and we definitely want to say that we are open to collaboration with all other groups and chapters. So, so currently we have 1,406 members, 1,175 of those are students. So we're currently working on a scholarship given our representation. Also, for members, it's $25. For undergraduate students, it is free membership. And so I'm just going to prattle this off for you guys quickly because we've done too much stuff. So given that, we are very present on LinkedIn. We have 2,342 followers, 484 on Instagram. We do send out a monthly newsletter to all of our members, updating them on RNAO initiatives, upcoming activities of the BNLC, and news of our interest to our members, including our monthly Strut Your Stuff, where we celebrate accomplishments of our members. Our BNLC chair, Lori Zazzolato, continues to attend and participate with the RNAO Health Equity Consortium that meets regularly to share their respective interest group priorities and provide RNAO with ongoing feedback and identify opportunities for collaboration to address and advance health equity, diversity, and inclusion in the nursing profession and health systems. In January, all executive members of the BNLC participated in filming videos for Black History Month, and in February, those were presented on RNAO social media sites. In February, we hosted our first in-person Black History Month celebration at home office with the theme of resilience. This event was attended by 20 people and featured amazing speakers, Dr. Bukola Salami, Dr. Josephina Toa, and previewed the latest RNAO best practice guideline addressing anti-Black racism in nursing. That was presented by Dr. Stephanie Buchanan and Lindsay Howitt. Then, I know, lots of words. We also had a webinar on resilience by motivational speaker and psychotherapist Charles Skeet, and Doris did attend that.
Time's up, thank you. Okay, next we have microphone number 1, Roya.
Hi everyone, my name is Dr. Roya Hariri Vijay. My pronouns are she and her. I'm the PPAN for Durham Region and also Rainbow Nursing Interest Group. So we want to bring to your attention a few things, and we want to be so appreciative of RNAO and the head office for supporting the Durham chapter to plan for our Pride Month. The Pride Month is coming for all of you. If you don't know, I'm just going to make more work for Leanne and the team at RNAO. They're very supportive. They can help you with the registration, with goodies, with all that wonderful stuff. So please, please participate. We don't all have to come to downtown Toronto to participate and show our pride for our 2S LGBTQI communities.
And I'm going to have goodies, so they need to compete with me for goodies.
Yes.
Doris, you need to use the microphone.
I think I projected enough.
Yeah, okay, good.
And one last thing we were going to share from the Durham chapter. If you like to follow us on social media, when there's wonderful research that our members are doing, for example, around migrant 2S LGBTQI students, about Black nursing students, about migrant healthcare professionals. We are doing a lot of work and we're sharing it, so please follow us, and because we want to make a difference in our healthcare system. So thank you so much.
Thank you, Roya. Microphone number 3. Ruby.
Hi everyone, I'm Ruby Amoncho, representing Waterloo chapter and SNIG RN prescribing. So for Waterloo chapter, we have continued to bring a lot of our members' voices to local politicians. So we have used surveys and member polls, and then using that, the nurses have shared what they believed were the most pressing challenges affecting our profession. So those were the insights that shaped the discussions we had with our local MPPs. And then we also recently had a social media collaboration with our local MPP, MPP Ashlyn Clancy. And that's just that's just the start, because that one is to promote our Nursing Week event, our upcoming Nursing Week event, and then the future social media and media collaborations are more going to be focused on our local advocacies and like priorities to bring nursing issues forward. We also just started, but we're releasing the next feature of our joint newsletter with Wellington chapter. And we also had 2 of our chapter members who reached out to our local organizations to bring the anti-Black racism in nursing best practice guideline to be implemented there. And we had positive reviews, and we are doing work in implementing that, and we are still having those conversations with leadership from that organization. Also, thank you so much, RNAO, for giving or for having us as Chapter of the Year.
Thank you, Ruby. Thank you. Okay, so now we will move on to microphone number 2, Matthew.
Matthew McGuigan, Community Health Nurses Initiatives Group. So this year we launched 15% off old trainings through the Canadian Healthcare Education Network. We held Dion Sinclair as a guest speaker for a webinar. We've handed out over $10,000 in education and research grants. We've provided $1,000 worth of awards for nursing weeks, and we earmarked $40,000 worth of funds to send 20 delegates to Vancouver for the CHNC biannual conference, as well as we have been acting as consultants for the CHNC Public Health Nurse Standards, which I think are coming out sometime this year, but that's above my pay grade. Thank you.
Wow. Thank you. Okay, microphone number 4.
Hello, my name is Avery Jackson. I'm an MP and Champlain chair. We are a new executive team consisting of only 3 members. Currently, we're navigating some barriers of increasing our numbers in a rural and expansive region, but we are looking forward to continue to connect and amplify the voices of rural and small town nurses in the Champlain region.
Thank you. Microphone number 3, Stephanie.
Stephanie McClarty with Region 10 Ottawa, and we're really pleased to have a strong executive team that with all of our positions filled and lots of activities that are happening. In particular, some of our outcomes and achievements this year have been having 2 anchoring large in-person events, including our fall tour that we partnered with the Palliative Care Nurses Interest Group, and we had Sue LeBeau attend with us. And we saw the opportunity for many members to come out to their first RNAO event ever, or the first event in a very long time. So we were really pleased to open that door and create that opportunity for them to attend. We also had a virtual event, Nursing in the Age of AI, which we partnered with the Nurses Informatics Group, which we are really pleased to have such a huge turnout and engaging conversation. Nursing students in our area are incredibly active, and we're pleased to have them here, including members from the new program at Carleton University, which we showed up early on and did presentations, myself and another executive member, to the inaugural class at their first few weeks to let them know about RNAO, and we presented to their professional practice group and recruited the whole class as members, as well as members to our executive. We're really pleased to talk about our political advocacy work. Kudos to Jenna Bennett, who's not here today as our PPAN, who was instrumental in continuing to build relationships, where we were able to have our second event, the Breakfast with Politicians, the annual event. It continues to grow. We have representation from all 3 levels of government that come and attend, including one of the only events where the Conservative representative came, and I was able to secure some follow-up conversations with him, MPP DeRuse, where we really talked about some of the some of the red tape issues that are happening with implementation of new initiatives, and how do we get that down into the realities where the nurses are working, and he was really keen to listen to that. We're thankful to have MPP Tyler Watt, the fellow nurse who's quite engaged in our area and our supporter. We're incredibly proud of the work that happened with our workplace liaison, Nazria, who's here today, with really championing and supporting some of the issues that are happening in Ottawa around the 400 nurses that are being cut from some of the area hospitals. And so she was really active in that, and thankful to Tracy for her social media and exponential growth.
Thank you, Stephanie.
To do two things. First, to take a picture of one of the senior management team doing the job of someone else. Beautiful, giving a break. Second, Dr. Imogene Bainok, past president of RNA, I saw you walking in. Can you stand up and be recognized, please? And two things. My co-author with this, that's number one. Second, you have a job, because you were not in the morning. I keep an eye who is here and who is not. And is to tell Dr. Jocelyn Hazayak that we knew she was watching, that we put a picture of her, that when I called her and we spoke 2 days ago, she told me you had gone to visit her. So tell her, everybody.
Thank you. We are going to microphone number 2.
Yes, hi, my name is Ingrid Daly. I'm the chair of the Ontario Peri-Anesthesia Nurses. We specialize in pre and post anesthesia care with a background in critical care medicine and emergency medicine. We're this year's recipient of the Interest Group of the Year Award. We won that. Yay! We have a full executive. We've had 5 virtual webinars. And we have our in-person webinar this year at Trillium Health Partners. Thank you to Farah Khan, our VP of Patient Care Services, who's allowing us to have our in-person webinar in October. And our executive is from all across Ontario, Thunder Bay, North Bay, Ottawa, Belleville, Hamilton, London, Ontario, Mississauga, Toronto, Unionville, Markham, and Peterborough. So our executive sits from across Ontario. And I just want to thank RNAO for all the support. I've been a member for over 25 years, so thank you. And that's it.
Thank you. Andrew, mic 4.
All right. Yeah, Andrew Marlowe, representing the Mental Health Nurses Interest Group as the chair. We've had a busy 2026 already. We've hosted 5 events in 2026, one celebrating International Mental Health Nursing Day. Just yesterday, we had our AGM. Some nice synergy there with today's AGM. We also held collaborative events with the Research Nurses Interest Group and the Diabetes Nursing Interest Group and the Windsor chapter. Kathy mentioned we had 150 members joining, also a few MPPs, which was great because it is a very important political topic. And as she mentioned, June 18th is our second in that series. If you're interested in collaborating, we definitely want to collaborate with you, so reach out. We also awarded 3 bursaries for research in mental health and substance use. Myself and our co-chair attended Queen's Park Day. Janet Hunt from the London chapter, myself, and Huda from the now Board of Directors met with an MPP for Queen's Park on the road. We've continued our monthly newsletter, keeping that sustained, which has been great. And then finally, last year, I was the only executive at our AGM, like here today. This time we have 5 people in attendance. So we're really rebuilding that active, engaged core of our executive. We still have a lot of open positions for regional reps, so especially people in the chapters, whether you're in mental health yourself or you just know someone who is, definitely have them reach out. We're electing those positions over the summer. We'd love to get a full slate for our regional reps and our open executive positions. And that's all for me.
Thank you. I'll stick to microphone number 4.
Alrighty. Hi, everyone. My name is Merit Sadek, co-chair of Staff Nurse Interest Group.
Hello, everyone. I am Damali Austin, also co-chair of the Staff Nurse Interest Group.
We first wanted to get started to say that we got accepted to the honors program this year, which is a huge win for us. And just wanted to share a few very exciting things that we did over the year. So we launched a social media campaign on Instagram and Facebook for Nursing Week titled Behind the Scrubs, where we wanted to sort of encourage our members to share more about themselves and why they chose nursing. We also awarded our yearly nursing bursary, which is really good. And then we held webinars throughout the year focusing on nursing wellness, supporting nurses, and really just having fun. So one of our webinars was actually with the new RN interest group for new grads titled Thriving, Not Just Surviving as a New Grad. We also had a very fun nursing face-off Jeopardy, and it was actually led by two of our students. It was a lot of fun, and we also had a fireside chat that was really virtual with authors Tilda Shaloff and Lisa as well about their experience and their new book. We currently have 3 students, but we're also always welcoming more students to join. And there's currently an opening for our communications E&O position as well. And I'll hand it over to Damali.
Okay, thank you. Thank you, Merritt. So we just actually want to say that with our RN prescribing community of practice,
We have
CNO
30 seconds. 30 seconds.
Okay, perfect. CNO has publicly acknowledged the SNIG RN prescribing COP work as part of the ongoing collaboration and peer learning across the province with RN prescribers. Merritt and I are really, really excited for the future of SNIG. We're going to be looking at member engagement, specifically ensuring meaningful engagement, and most importantly, promoting our mandate.
Thank you.
The health and well-being of our nurses.
Thank you. Thank you. Microphone number 1. I see a new speaker.
Yes, hi, my name is Crystal McCollum, and I am chair of what was formerly known as the Ontario Wound Care Interest Group. That group had been pretty dormant for a number of reasons for over the past 4 years, and we're excited to tell you that as of this past summer, we have established a new executive and have a growing membership. Thank you. At our AGM in April, our membership voted to change our membership qualifications to align with RNAO, which now makes us a provincial interest group of the RNAO. Our membership also voted to change our name to reflect our change in membership, so we are now known as the Wound Care Nursing Interest Group. As we work to reestablish the group, we have come up with a monthly schedule of educational webinars for our members, and we are collaborating with other interest groups and chapters in order to offer that. And we will have some elections this spring for student E&O, PPAN, and social media E&O. And we are so very proud to announce that our student E&O, Naishir Dang, was awarded the RNAO Student of Distinction Award this year. So congratulations to her.
Thank you. Microphone number 4, Sarah.
Hello, I'm Sarah Miliaho. Sarah Lynn Miliaho. So my namesake would have been really happy for that interest group because Sarah Miliaho is a wound care nurse. She's an NSWAC. I'm a nursing practice lead, BPSO lead, and the Lakehead chapter chair. First of all, I would like to say congratulations to Dr. Michael Scarcello, who is our Region 12 rep. And I'd like to say we're incredibly proud of Region 12 because for the first time in a really long time, Kenora Rainy River, you're here. So that's really exciting. And Sulacote is here and Lakehead chapter's here. So huge round of applause for Northwestern Ontario represented here. For the first time in a really long time, we also have 5 E&O here as consultation reps. And an astounding, because of our growth in membership, we're allowed 7 seats. So to have 5 out of our 7 here is such a rewarding feeling. And we have 2 nursing students here. So all the way from Thunder Bay, we're here. We're loud, we're proud, we're representing Northwestern Ontario. And in terms of what our chapter's been able to accomplish, really and truly, our social media presence has grown. That's all thanks to Rylan Copeman, who's our social media ENO. So our presence is very much there on Instagram and Facebook, and we're looking to likely increase that presence as well on other platforms, but that's where we've started. We're very happy that Morgan came and our chapter was able to host her in Thunder Bay on her journey to go across Northwestern Ontario to really get increased membership, engagement, and to revitalize some of these chapters. So we're so incredibly proud that RNAO Home Office is making the efforts, and we feel it and we see it, and you've come to the north. Even Dr. Doris Grinspan had come during our fall tour. So we're so incredibly thankful that you're doing so. And then both Dr. Michael Scarcello and I have become best practice champion trainers, so we're happy to be able to grow in the knowledge and experience of RNAO and BPGs within Northwestern Ontario. That's very exciting. And really and truly, we are just so proud to have a voice in the North and be here. Our PPAN was incredibly influential, and we met with MPP Lise Bourgeois in terms of for the MPPs on the road. So we're happy to be here, happy for the increased engagement, and go Northwestern Ontario.
Thank you, Sarah.
Thank you.
Okay, so now we're going to go to microphone number 1.
Paul-André Gauthier, I'm an Executive Network Officer for the Sudbury chapter, and on behalf of the chairperson, Dr. Christina McMillan-Bull, I would like to do a short report. So the Nursing Week dinner we had since 2008, we are paying for the nurses attending our dinner. It's RN, nurse practitioner, clinical nurse specialist, retired nurses and RPNs, BSCN students, and practical nursing students. We charge $5 to make sure when they register, they are showing up, because we have to pay for the people who are absent. So we had a great dinner again this year, and one of our students who spoke earlier, she was attending our dinner, and she got the main prize. The other thing too, this coming week, we are going to be planning the activities for 2026, 2027. Already there, see, we're coming up. And this year we had 2 voting delegates. Alison Norton, please stand up, and Dorothée Boyer from Sudbury. Thank you so much for your attention.
Thank you. And now next we have microphone number 2.
Okay. Hi everyone, Sasha from Durham chapter, I'm here again. So just want to do a big shout out to our consultation rep. Durham was allowed to bring 15 consultation rep. I'm happy to say we have all 15, 4 of which are on our exec. Also wanted to share some really good news. Thanks to our communications ENO, Sherry Nesbitt, for securing this. We have a special offer with Thermea Spa for Durham region nurses and nursing students. Once you're a Durham member, you're able to take advantage of the offer of 25% off. So the offer will start from June the 1st to August the 31st. So please take advantage of that. We all know as nurses that self-care is important, and we do need that balance. Lastly, we do have one of our members that is attending York. She's doing her PhD study. And this is to the Black nurses working in long-term care. The study is to explore how Black nurses work in LTC settings, perceive and navigate pathways to formal leadership roles. Your stories and insight can help inform policy support systems and leadership development to better reflect the experiences of Black nurses. So please reach out to the chapter email if you're interested, and we can send you some information.
Thank you, Sasha. Thank you. We are now going to microphone number 3. Paula.
Thank you, Madam President. Paula Manuel from South Simcoe chapter. I wanted to just share the 36 years of experience being on executives for RNAO. I know a few things, and what's nice is to be able to share that expertise. So anyone that's in the room, please ensure you contact the RNAO staff so they can hook you up with mentors. Us older ladies mature, well, most of the time. We can provide guidance for you because we've tried some of the initiatives, and we can let you know what some of the pitfalls can be. And I'm very thrilled that Halton chapter is really resurrected. It's a bigger force than Wellington chapter. It's really nice to see. And I also willingly signed up to UNA for the Retired Nurses Interest Group Communications Officer. So if you're all excited about getting retired, I'm coming up with that topic again, not except for Doris.
Thank you, Paula. Thank you. We are going to microphone number 2.
Thanks, Lemo. Hi, everyone. My name is Jess. I'm the chair of the Complementary Therapy Nurses Interest Group, CTNIG. Thank you. And I really appreciate that. It's been a wonderful 4 years, so this is actually my last member voices as chair. And I have lots of wonderful things to say. We actually have a full executive for the first time in recent history, and so that's been a blessing, especially with having our student representative and our PPAN, Margarita, and Crystal, our ongoing treasurer, and we've got Darka in the back. We also have our poster in the hallway, so you can say hi to Elaine there and pick up some treats and some of our wonderful newsletter copies, and copies of the poster that Margarita made for Nursing Week. So we're really grateful for all the wonderful energy, and a big focus of what we always do is really concerned about wellness, and so how complementary therapies really blend into that holistic perspective of how we as nurses can be our best selves and provide our best care to others. And so we had a really wonderful event at the Toronto Botanical Gardens in April, an in-person event, which we actually opened up to all of you. And so we did have some other folks come from other areas, but it was really wonderful to have people together. And we did forest bathing and had a wonderful shared meal and had an art therapist. And so it was a day that I really created for us to feel taken care of, because I think it's important that we care for others, and it's important that we do self-care, but I think we also need to receive care. And I think that's something that, as I'm closing out my time here with you, that we can all sort of make sure as we're giving care that we also receive it as well. So thank you. I've received so much from all of you, and it's been a blessing to get to share this space with you guys. So excited for your continued work. Thank you.
Thank you, Jessica. You have to say something? You're the last one.
Hi, I'm Trinity. I'm the social media E&O from the Hamilton chapter. I just wanted to do a really quick shout out to all of our students. We have had an amazing year with our students. I don't know when the last time we had active student E&Os, but this year we had so many applications that we had to read through, and it was just really amazing to see how many students were passionate about RNAO. Have been wonderful. One of them is here today with the Board of Directors placement. And we've also had students who are not in our executive plan whole events at the universities in Hamilton. So a student at McMaster University, her name is Ashby, she's not here, but she planned our Avenues of Nursing event with myself and a few of the other executives, where we had multiple nurses of different pathways come and present, and it was an amazing event, and she was really integral to that. And as somebody who was a student a few years ago, it's been really amazing just to see the increase in students getting involved, because they are the future of this profession. So yeah, thanks.
Thank you, everyone. It always amazes me at the activities that members continue to do across the province in different sectors, facing different barriers and challenges and obstacles, and coming together to deliver the best that they can. Doris, do you have anything to add?
I just marvel at how much you are walking that bridge that we spoke this morning, all of you, and creating new bridges and new dreams. And I also marvel when I think past history, and many of you can relate to that, not enough executive, not enough this, not enough that, not enough this, not enough that, and to hear now that your executives are full or semi-full or almost full, to hear that people are coming from all over with their voting delegates, it's just inspiring. And if any of you, and I know some of you had questions and wanted help on things that may not be on resolutions, please connect, because some of those things we are working ongoingly, so don't despair. Also, and Madam President did say this morning about the deadline for next resolutions, remember, you can put resolutions throughout the year. You don't need to wait till the last minute, right? Not that we will vote on them before, or not vote, but consultation reps. Resolutions are not direction, are guidance. That's why they're in the afternoon. You can do that throughout the year. And we may tell you it's not worth to put a resolution because we are working already, we can work together now more, or etc., right? So don't wait. If something is burning, give us an email, give us a WhatsApp. get in touch. Fantastic, amazing, amazing work. Amazing work.
Thank you, thank you. So now we are going to move into the lunch session. Complimentary luncheon is being served in the foyer area. Seating is available. Please refer to the posted signage. We encourage you to network with your fellow members and BPSO members, as well as visit the exhibits and the chapter region and the interest group posters throughout the lunch break. Enjoy your lunch, and I ask that all of you return at 1:15 promptly for the consultation session and to vote for the 17 proposed resolutions. We are all coming back at 1:15. Thank you. I thought about it. That's it. Yeah. It's 1:15.